Good morning, everyone, on this fine day. It's a fine Tuesday, bright and early, and we're ready to seize the day, and I hope you are as well. So a lot of activity, but we're humbled to be here. We will now call the work session for September 24th, 2024 to order. I would like to thank everyone for being here, especially our staff. I'm seeing y'all out there. Yeah, I see some waves, very nice. Appreciate y'all being here today for sure. I love to say we're humbled to serve along the most educated workforce in America and the most dedicated workforce. So we appreciate all that you do. So I'd like to start by reading our Who Are We statement. We are the Polk County Leadership and Governance Team. If we were to pick one phrase to define us, it would be student-centered, because when we come together to work, we lean on our diverse backgrounds and our experiences to ensure that our decisions are focused on providing a high-quality education for all students. The four most important things to our governance team include, number one, operating with integrity; two, respecting our students, staff, families, and each other; three, establishing a culture where stakeholders feel valued, they're supported, and have opportunities for personal and professional growth; and lastly, supporting an approach of continuous improvement to ensure that we have high-quality student outcomes. So collectively, we need to work on behalf of the children that we serve and find avenues of agreement so that we can govern the district in an effective manner. There's no acceptable alternative. We will always collaborate in a respectful manner in order to enhance opportunities for each student and staff member. And we will not disparage others. Our students will thrive because when we remain committed to supporting the whole child, there is student success. We hope to engage and empower our students and stakeholders to create a community of lifelong learners. So at this time, I would like to hand it over to our superintendent to lead us in our work session.
Good morning, Mr. Chair, members of the board, members of staff and community. Thank you for being here this morning. So the first item before you is Zen City Enterprise accounts. I'll ask if it's working. So just to provide context and background, board members had requested a little over a year ago for us to explore other opportunities to gather community and stakeholder feedback on a variety of topics. That the board several of you expressed concerns that for various reasons, there are only certain individuals who will show up to a board meeting and share their perspective, which can be misleading, right? That's the community's perspective or the only perspective that you should take into consideration, and that's just simply, many of you wanted to be able to get additional information. So over the course of about 6 months, we scheduled a variety of meetings with at least 4 companies to discuss their options and what solutions they offer. Just so you're aware, we do have internal surveying tools, but this was a tool a little bit more explicit, more specific to board needs. So SurveyMonkey and things like that, we have limited licenses for. Other embedded survey platforms that we have within Google, Google Docs, Google Forms, Google Survey are somewhat restricted and limiting. And there's always a concern when you develop a survey, survey questions, and the art of designing survey questions it's a real thing. For lack of a better way to say that, you know, outside of that, more often than not, surveys and survey questions can actually be written in a way to lead the respondent to a certain outcome. And we want to make sure that that's not the case. But throughout our review with multiple companies, I did ask for a board member to be a representative at those meetings. I asked Ms. Miller. At the time, this was something we discussed a little over a year ago. Ms. Miller sat in on each and every one of those committee meetings, or those meetings with those vendors to review their product, the quality of their product. And so what you have before you today is Zen City. Zen City is what I'm bringing before the board at this time as my recommendation for adoption, because out of all of the utilities, they had the most robust AI capabilities. And so essentially, beyond just our ability to send surveys out to individuals, they also can provide survey support. So if there's a particular topic that the board would like to receive additional information on, they can help because they have a repository of questions that already exist, or they can help with crafting those to ensure that we're getting the type of response or a meaningful response rather than a leading response. In addition to that, their AI technology will actually scour social media, websites, and other places where our parents and community members may be communicating. Because again, our surveying capabilities as a school district are limited to just those parents who are registered with us and provide an email address. We do not have the ability to survey community stakeholders beyond those that have a direct relationship within the school, with the school district. So what Zen City can do is they can provide that contact information so you can survey by district, by area, by zip code, by community, municipality. So there's a lot of functionality here. And so again, this is why I'm bringing this back to you, because this is basically the culmination of almost a year's worth of work of reviewing multiple companies that would allow you to gather information on your own or with support from the district or with direct support from Zen City. So they actually exist right now in multiple private sector areas. They work with multiple municipalities. We do believe at this time that we'll be able to piggyback off of one of their existing contracts. I will provide that to Mr. Murphy, given the transition period that we're in, allow his team to look at that. If they believe that indeed we can piggyback off an existing contract, then obviously I would bring this back to the board. You're not voting on this today. We have plenty of time. We have actually we have a considerable amount of time before your next official board meeting for you to ask additional questions or for me to give you more information that you may need to make a meaningful vote or decision. So if Mr. Murphy again approves that or confirms that, yes, we can piggyback off their existing contract within the state of Florida, then we will do so. If not, then we would basically advertise it, and there's enough time between now and the voting meeting to ensure that any other respondents can be addressed or reviewed, and I would bring a formal recommendation to you at that time again. But again, that's all contingent upon whether or not Mr. Murphy or his team can verify that we can or cannot use the piggyback process. So we do have representatives here from Zen City. I'm going to go ahead and invite them to come up to the podium to allow them to go through their presentation and answer any questions that you may have today. Good morning.
Thank you so much. I want to thank the board first and foremost for inviting me to present today, and thank you everyone for taking the time out of your busy schedule to come to this meeting as well. Just to set a brief agenda, I'll quickly introduce myself before walking through the Zen City platform, some of the great folks we get to work with across the state of Florida, and as well as the solution and our customized proposal for Polk County Schools. My name's Sophia Lewenberg. I work on our enterprise account executive team here at Zen City. Spent my whole career working with state, local, federal government, background in resident engagement, working at Qualtrics with Southeast states from Florida Department of Child and Family Services to Texas WIC. That's a little bit about myself. At a high level, we at Zen City work with over 300 public sector organizations to give executives like yourself a better understanding of resident perception before launching or investing new programs. And as we continue to grow our partnerships across the state of Florida, we work with folks like Sarasota County, Pinellas County, Tampa, Orange County Sheriff's Office, but all of them use us to understand what residents think before changing new policies, investing new programs, and keeping a pulse on community. Okay, great. And we know that the current methods of community engagement as where they stand today are pretty limited. We see that there may be in-person forums such as this working session for us to hear community feedback. We might have other events where we see parents coming in and providing feedback around changing policies like adjusting school start times or different safety initiatives that we're trying to implement. But it's challenging, right? Because how many people can take the time out of their day to come to a 9 a.m. meeting on a Tuesday? How many people realistically throughout the county have the ability to give you feedback? Whether there's a language barrier or transportation issues, we see that it's really challenging to hear from folks, and we tend to get the 1-star reviews and the 5-star reviews. So we're doing really, really great at a certain service, or somebody's really satisfied with a policy, or somebody's knocking down our door and saying how horribly we're doing at something. But it's challenging because it provides us a skewed view of what the residents in our county actually think about the school services that we're providing. And when we have data that's coming from just a few folks, we can make decisions that might not be representative of what people truly want. And that's where we come in at Zen City. So we realize that most folks are online, regardless of your socioeconomic background, language barriers, or where you live within the county, we tend to see that most people have access to a mobile device, whether it's a laptop, a tablet, or a smartphone, something that has internet connection. And so what we've done is we've created a low barrier approach to meet folks directly where they are, so you can get this feedback in an ongoing basis. There's 3 things that we do, and I will walk through them right now. One is we aggregate all publicly available online discourse and we put it into a dashboard, really allowing you to monitor the impact of changing policies around security, transportation, school start times, and other initiatives you're trying to do. The goal is to understand if we have an issue that's truly pervasive and it's, hundreds of parents or, Polk County residents that are upset around us changing a bus route, as an example, or if it's 3 people in a Facebook group, and quite frankly, we don't really need to address it. Because as you all know, it's really, really challenging when we have limited resources to dig up something that might not need to be dug up. The second area where in our toolbox is we use digital ads to representatively survey our community. So as a Polk County resident or parent is scrolling on Instagram or Twitter or playing Candy Crush, they will see an ad asking for their feedback around a new policy that you're looking to implement. It takes folks 2 to 5 minutes to answer the survey. They don't even leave their browser, and they can just keep scrolling. And the wonderful thing about our technology is the survey mirrors the language that the device is set to. So if I'm a native Spanish speaker, the survey will come in Spanish, which lowers the barrier for us to be able to get that feedback and give it to you board members so you can create actionable change. Our surveys are also representative based on your census data. And we have the ability to do that because we just pump out digital ads on different platforms until we hit our representation quotas. The third tool that we have is our engagement platform, which allows you to build customized web pages in essentially under 5 minutes. So we have an integration with ChatGPT, and essentially you plug in a few prompts, you put in a few sentences around a new initiative you're looking to launch, maybe around getting feedback around school start times, and you spin up a website in under 5 minutes. Residents can go to either access the website digitally, or you can have QR codes where folks can scan around buildings such as this, or you can have a child take home a piece of paper that has a QR code on it, parents can scan it, and it closes the loop on resident education. You can do budgeting exercises, residents can see timelines, they can provide survey responses, and all of our technology is purpose-built for government. We only work with public sector organizations. So as survey responses or publicly available data is fed into our live dashboard or fed into our survey responses, you can automatically know that the number one concern around changing school start times, for example, is security. Instead of having to read through a couple hundred comments to be able to have that information, we will prioritize it and bucket it as it's coming in, so you folks can be proactive on the data versus reactive. And this is what we call Zen City 360. So I'm going to quickly recap the tools for you folks. First is our organic listening platform. This allows you to see conversations within your community at a high level. We can create customized project dashboards, which are tracking information around different initiatives that you have, whether it's school buses or new buildings or different referendums that the board is trying to pass. And essentially the goal of this is to allow you to understand if an issue is pervasive or merely a blip on the radar. Once we listen to the community, we want to survey them to ensure that what we're hearing online is what folks actually want. This allows us to triage the data that we're seeing digitally and on our different social platforms with the survey information. Our surveys are delivered via digital ad on different platforms. They're representative based on your census data, and they come into the device in whatever language is native to the device that it's set to. Also, our surveys are translated back into English, so you folks can see that information, and you don't have to have somebody that's fluent in every language to be able to understand what folks are saying. The third piece of our tool set is once we've listened, once we've surveyed, we have the engagement platform, which allows you to create these customized web pages very rapidly. I am not a data scientist myself, and I can create these pages very quickly. Our AI integration allows you to plug in a few prompts to create a website where residents can see timelines, they can do budgeting exercises, answer survey questions, sign up for notifications around different projects that we have, and really close the loop on some of the initiatives that we're trying to push throughout the county. Any questions on what I've shared so far, or would you like me to jump into the proposed solution? Great. Okay. I have 2 minutes left. So I like to take a step back and kind of summarize some of the conversations that we've had. Oh,
So respectfully, if you'll wait for me to call on board members to answer questions.
oh, sorry.
So go ahead. At this time, I'll recognize Ms. Miller.
I just have a question as you were talking about that and talking about countywide initiatives. Is this something that can be partnered with other government, local government agencies if we're doing cross-agency initiatives? Because you talked about safety and that just sprung a new question into my mind.
Yes, so thank you so much, Lisa Miller. We do work with a variety of government agencies, and you can see when it comes to partnering with other organizations around the state, you can actually, there's an ability within the organic tool to see, we have a press releaser, so you can see what other entities within the state are releasing. We also have great partnerships with other law enforcement organizations as well, but you can share the data with other entities. I'm not sure if I'm
No, that's what I was thinking.
Okay.
So we could take this data, if we collect data on a county, an initiative that we need to share with the county, we could, even if they're not doing the same surveys, we could share data with them to make a collaborative decision. Okay, that just came to me. Thank you.
Yes, ma'am. And within parts of the platform, you do have a team of analysts and survey research methodologists, excuse me, that will comb through the data. And so if there's a trending topic that you see, our team will go ahead and analyze that and create a 30 to 60 second, excuse me, SWOT analysis of the data. So you can present it at a board meeting like this, and you don't have to comb through all the data essentially. You can do it ad hoc, or our team can also be there to support you as well.
There are no further questions. Go ahead.
Okay. I know I have 10 seconds left, excuse me, but here I highlighted some of the current state challenges in our proposed solution. We talk about how it's challenging to hear beyond, some of the loudest folks, and our proposed approach around mapping, tracking, and assessing policy, but I'll pause here because it looks like I'm out of time. So.
I'd like for you briefly to go into the next slide, if you wouldn't mind. I'm less concerned because I'll share the cost analysis with the school board, but I'd like you to go ahead and discuss the organic, the pulse survey, and the engage aspects, if you would.
Yeah, of course. So I'm going to just jump ahead to Send City Organic. So this is our overview of our organic discourse and sentiment analysis. So all of the discourse that's publicly available, no messages between you and a family member on Facebook will be visible to the board, but essentially all publicly available discourse is fed into a dashboard, so we can understand conversations that are happening within the community. We can also pull in insights from news, media, blogs. We have a direct integration with Nextdoor, one of the first companies in the United States to be able to aggregate data that way. And essentially, you can have a high-level view of discourse within the school district. Anything else about the organic platform before I jump into the next slide?
No, ma'am.
Okay, great. So these are our Zen City Pulse surveys. These are ad hoc representative surveys. In speaking with folks on the board, we thought that this would be the most flexible solution for the folks here. So essentially what you do is we have a team of survey research methodologists, including Dr. Levenstein, who their entire career is built around survey methodology. These surveys are non-biased, they're created to be as non-biased as possible, and we work with you around the question. So if you have a specific goal or initiative that we're looking to get feedback for, we will work with you to create the questions, and then the surveys are deployed via digital channels, so through digital ads. Think Facebook, we work with ad networks like Meta to be able to deploy different ads. We also work with you on the ad design and creation, and our surveys are typically live for 6 to 8 weeks. That's about how long it takes for us to collect data that's representative. We also employ a technology or a methodology called rake weighting. That means because we actually oversample a large amount of the population, we will weigh down demographics that are overrepresented, so you can hear from everybody in your community, and then we create a report for you. So our team will generate a report, and it's something that can be presented in a public forum. We see this with a lot of our other clients, like Sarasota County does this with us, Pinellas does this with us, but essentially they can present the data in a public forum as well. They're representative based on the census data as well. Any other questions on the pulse surveys?
No, ma'am. Oh. Dr. Allen.
Well, again, thanks for being here. This is great stuff. I'm intrigued. I mean, anytime we talk about in our boardroom utilizing AI tools, my hopes are that we'll see that come before us and how our students can implement AI tools as well. And I know I keep speaking about that, and we'll continue to speak about that until we see it at this board. I'm curious about the database that's collected, right? So, and then I don't know if this is too nuanced in my questions or whatever, but how do we build out the database that we're actually targeting with our surveys? So we've got 123, approximately 1,000 students. Is the database there from those family units? And then how does that correlate to the data that we're collecting, say, in our social spaces?
Yeah. Thank you so much for the question. I love it. So what we do is first we'll geofence the area of the county because we only want to hear from folks that actually live, work, and play within Polk County. And we can also, we'll ask qualifying questions within the survey, like, can you provide a zip code? So we can also kind of double check the work as it's coming in. And then we can ask questions around, are you a parent of a child in Polk County? And we can, discard the survey responses that are not, or if we're looking for a broader representation of the county holistically and we want to understand what all residents think, we can also input that data. Or we can also collect that data as well. We do not collect any data, or we do not include any data that is not fully completed survey responses, as well as if we see somebody that's clicking like AAA and they're just not really filling, that is also thrown out from a data quality perspective. Mm-hmm. You asked another question.
Yeah, I mean, I was just curious how it's correlated to like our database, right? So, if we're collecting data off of the social spaces, how do I know that data is connected then to, our constituents? And when I say constituents, I mean that asks a bigger question as well. Are we separating out like who our voter population is comparative to, our family units and so forth? Just, I don't know, I'm getting too nuanced in the questions, but this is all fascinating. Mm-hmm.
No, not at all. Not at all. Thank you so much for the question. So that's on you guys, right? So if we want to pull data in from our residents holistically, we can do that with one survey. But if we want to just pull in data from, parents within the county, we can do that as well. So you have the flexibility within these surveys to aggregate data from both sources. And then when we talk about the social listening piece, which is which is separate, we actually work with you around sources to collect. So what we'll do is we'll sit down with you during the onboarding process because you will have a dedicated CSM that will work with you, every step of the way and make sure that you're comfortable with onboarding. But essentially, most folks know where, certain news that we want to follow or certain influencers. So what we'll do is you'll give us that information and we'll also provide maybe some suggestions like, we see park lovers of Polk County, for example, and maybe there's a lot of discourse around some education initiatives because they have to do with, parks, for example. Maybe we'll suggest those as sources and we'll have that data aggregated into a separate dashboard.
Yeah.
So it's built for you guys.
Yeah, I appreciate that. And I think maybe this question is for the superintendent. When you say, because I'm hearing a bit that, we would have ownership of this, individual board members, are you foreseeing a place where if we pose a question as a board member, is it on our own? Or are you saying that these questions would then all come back to the board before they would be deployed? And then if we were to adopt this, Superintendent Hyde, is this tool then going out to different divisions within the district?
So the second question is the easiest to answer. The answer is yes. The entire school district would benefit from the ability to survey, whether we're surveying our own staff or whether surveying community or gathering feedback. You know, there's a topic today about the new high school out in the Point Siena area, right? And so do we want to gather feedback as far as its location or whatever other feedback is out there? No to individual board members in and of themselves surveying, because if the school board member, and I'll defer to Mr. Murphy, and he can correct me if I misspeak here, an individual school board member cannot act in that regard because they'd be acting on behalf of the board, not as an individual. So questions, interests would be funneled back through the board, given to me as directives or requests, and then we would funnel those and then provide the data and the analytics, but we would have to refine those parameters. I mean, you really started to get in the weeds there, Dr. Allen, as far as the kind of data you'll get back. And to my knowledge, I don't really know that we benefit from political ideology in the feedback as far as the demographic data, but I do believe that demographic data is important to understand how, and this falls very well within our strategic plan goal area of engaging our family and community members. And right now, I think we have a variety of tools. I think the question that many of you ask time and time again of yourselves, of us, of me, is while we have those and we communicate them very effectively, why is our response rate still so low? I mean, I think the national average for survey responses, if you get 30% of your target population to respond, that's considered an excellent survey response. I don't think you do either. There's a lot that will have to be nuanced here, and we'll have to develop rules and procedures, and the board will get to play a hand in those, and obviously we'll approve those ultimately. And again, the interest of today was to present this platform to you, and we have another workshop, and then another workshop and board meeting before this item can be voted on. So there's plenty of time for the board members to receive additional information from my team to start working to develop some of these things.
Great, thank
Mr. Murphy, did I misspeak about the individual board members utilizing this?
No, I concur with those remarks, and we would want to be real careful how we would implement such a product so that we do not have any issues relating to sunshine or other types of things. Just a quick question. Zen City sounds very familiar to me. Do you operate and have contracts with any local governments here, like, for example, the city of Winter Haven?
Yes, sir.
That's what I thought. Okay, thank you.
Mr. Sharpless.
Thank you. Thank you. My question is, you talk about how you're filtering the data, right? And how a variety of different ways you do that. Are we going to be able to get the data as a whole and also be able to do different filtering that we may want? Because each one of us may have a different priority or something we're wanting to see in that data. So are we going to have the opportunity to be able to do that?
Yes, sir. You have the ability to, I like to think of it as the initial dashboard is the 30,000-foot view of what's going on, what's going on that's relevant to us. And then you have the ability to create unlimited ad hoc project, we call them project pages, but they're customized dashboards. So you could have a project created around, for example, each high school. Or you could, and it would aggregate all of the conversations that are relevant to that specific school based on the parameters that you've set, right? So if there's a specific keyword or phrase, or maybe we want to pull in certain Facebook groups or hashtags on certain Instagram pages, just as an example, all of that would be fed into the dashboard. So you can track, the impact of policies over time and be able to map that back to your strategic initiatives as well.
Thank you.
Of course.
Ms. Fields.
Thank you. I'm trying to wrap my head around the whole idea, Superintendent Hyde. And the question that I had is the question that Mr. Murphy asked, if there was any other government organizations that you might be working with. But my additional question is school districts. Are you working with any other school districts at this time?
Thank you for your question, Ms. Fields. So we do work with a variety of local government organizations, Sarasota County, Pinellas County, Manatee County, Fort Lauderdale, Tampa, New York, Chicago, LA. But actually, this is the first school district that we would be working with.
Okay, thank you for that. And then Superintendent Howard, I assume you're going to talk a little bit about the investment?
Yes, ma'am. But again, with 2 other workshops and a meeting before we vote on this, I believe there was additional time for us to do that. I just wanted to make sure that they had an opportunity to present the platform in its entirety, because there are so many different tools and the manner in which they will disaggregate and analyze the data is really the most important and relevant part. You know, again, survey responses can be skewed based off who designs the survey. And in this case, their skilled staff will take that burden off of our staff, and they'll be able to provide more frequent surveying. And remember, there's a lot of informal surveying that takes place here as well, because they're able to look at social media, use that AI technology to see what conversations are already happening in the community around the topic that we may address here as a board. So if we're changing the student code of conduct, if we're changing, I'll give you a great example, school start times and redistricting or rezoning our schools are 2 very good topics that are very much on the horizon for you in the next few months. And so as we have those conversations, we do not want to rely solely on a handful of emails or text messages or phone calls that you get, and we do not want to rely solely on a very limited opportunity for people to talk at a school board meeting. We want to make sure that we're getting as much feedback from our parents who are going to be directly affected by those topics, and be able to allow you to make an informed decision as a school board when I make those final recommendations, and to allow me to have the appropriate data to make that best recommendation to you based off that feedback. So that's the intent, that's the purpose. Again, based off their success in the private sector and with multiple municipalities, I felt the tool would be a good fit based off the interest that the board had demonstrated or shared with me previously.
Can I finish, sir, please? Thank you. I would suggest that as we look at this, because of the value of the concept and looking at the investment, which to me is a large investment, that we maybe, and as a board member, we can easily do it ourselves, and I'm sure you all will, is maybe talk to the Winter Haven municipality and see how does this work for them, and what the value is. I'm just saying, I appreciate Superintendent Hyde bringing this to us, but again, I think the amount is rather high for me, and so I'm going to do my due diligence before I would commit to doing this. And as Superintendent Hyde said, we have a couple more work sessions to chew on it, but I'm going to chew on it pretty thoroughly.
And Ms. Fields, I'll be happy to work with them to get a full list of everyone they work with in the state of Florida, because I think we need, to your point, asking Winter Haven alone isn't the best thing. And so the board may decide to divide up the list, and each of you make calls to individuals, but that's to be decided later.
In addition to that, last night, I did a Google search, and I did look at the firm, so I already started doing my research. Thank you.
Yes, ma'am. Ms. Cunningham.
Thank you, Superintendent Hyde. My question is, it would be nice if we reached out to firms that already do this in school districts. There's got to be others out there to compare, because I'm with Ms. Fields. The price tag to me is extremely high. So I would like to see if there are companies that do what Zen City does, but they provide it for school districts, because to my knowledge, from what everybody said, is it correct that you've not done this for school districts, just municipalities? Is that correct? Or am I wrong? I'm sorry.
Yes, ma'am, you're correct.
Okay, so that in itself lies some concern for me. And I'd like to see if maybe there's a company or two out there that provides this service to school districts, and be able to compare versus just going with essentially what I would call a sole source company, even though they have a track record, if they do, with Winter Haven. But that's a municipality, and they're Their world is, in my opinion, very different. I mean, it's government, but it's very different than ours in serving students and their families. Ours is very particular in that respect. They do serve the community as well. So I would like to see another company brought before us to give a proper, comparison, because there's got to be somebody else that does this for public education. So I would love to have the opportunity to view that as well.
So there were 3 other companies.
There were.
Some of whom, again, I met over the course of a year, we met with 4 different companies. There were 3 other companies, some of whom do actively work in school districts, but do not provide the AI technology aspect, which is why I did not go with them. Because again, our ability to survey parents, we already have. We can send out survey monkeys, we can do those things. What we don't have is a repository of vetted questions that are well-designed, and those companies did not at the time provide any AI functionality that would go out into the community and gather those voices that are posting and having a conversation out in the community, but they're not conversing with us. And that's why I felt that ultimately they rose above others, but I would be happy to provide you with the names of those, and I'll see if I can work with the team to create a crosswalk of all the features so that you can see how they compared. And then if, again, depending on, really a lot of this depends on Mr. Murphy. If he agrees that we can piggyback off an existing contract, then that's different, as Florida statute allows. If he says no, then I'll have to put it out for bid again anyways, so you'll get the opportunity to see other vendors.
And I would think, too, as time goes on, AI capability is going to be part of most of all of these going forward. So perhaps if there was a company, that worked with other school districts, and if we, as well as them and others, said, hey, here's the capabilities that we're looking for, are you going to be moving in that direction? Perhaps, and then what would that price tag look like, and so forth. I just
ma'am.
hate to jump. I know you're not jumping because you said you've been doing this for a year and checking it out, but I think we need to evaluate it and probably have at least 2 options when it comes down to a recommendation.
Yes, ma'am.
Thank you, sir.
Mr. Murphy?
Thank you, Superintendent Hyde. And to your point, I would want to work with your procurement staff as well to evaluate the piggybacking and making sure that it meets all the required statutory and other requirements. So we can certainly do that.
Ms. Wyatt?
Thank you. I know Winter Haven has had a great experience with it. I was just texting Katrina, who heads it over there, and her response was, love it, core part of our strategies. So I know that it has been implemented very well in the Winter Haven area. Are there any, I know the one conversation that came up originally was when profiles are private and things like that. How is that still, obviously they're private as my profile is private, I hope that it is private. But is that still a challenge for you all, or is there anything that you're looking at towards the future?
Thank you, Ms. Wyatt, for the question. If it's private, we can't pull it in. And that's that. There's a lot of data privacy rules that we also have to follow on our end to ensure that we're not pulling data that's private. Again, we can't pull private conversations, we can't pull private Facebook pages, we can't pull private Instagram pages, but anything that's publicly available, Nextdoor, LinkedIn, public Instagrams, like your own Instagram, we can also aggregate that data. News channels, we can pull that data. Twitter.
Thank you. Again, as a Facebook user, it makes me feel very secure that my private data is really private.
Is, at least with us.
Ms. Miller?
Thanks. I think that's a good idea to send out the people that met and what the areas that they covered and provided, and also cost, because you'll see that some of these companies are very multiple times over expensive. But I think the AI feature is important. I think talking to the entire community is important. As a district, as a county of almost 800,000 people now, we have yet to be able to effectively communicate with them. This district is very large. Your Davenport area feels abandoned some of the time because their voices, whether it's a language barrier or they're so far away from this office, they don't drive here to our meetings. So I think it's a great opportunity to be able to reach those people and have them give input on what's important to them. And it may change, but depending, my North Lakeland schools may have different needs, obviously, than newer families moving into the community. So this is new to me. I think Chair Allen has the most experience in digital because of his background. But I've seen the need for a long time as a community member and now as a board member, making sure that all voices are at the table. So I think this is important, but like I said, I also think it's great to compare to other companies because the value we saw, I think, was evident. But of course, all of that information hasn't been shared. So I look forward to the superintendent doing that. Thank you so much.
Dr. Allen?
Yeah, I just want to say, thanks to Superintendent for bringing this forward. I definitely see it as a touch point for decision-making, not, the only point of decision-making, but it's smart. It's very smart technology, and I see the value of it. I would love to hear from you, Superintendent, and your staff, and how they can create a vision for how they can use and implement this technology. I know we've implemented some strategies with Qualtrics and some other things, so I would love to hear from our Chief Academic Officer and some of those areas and how they could benefit from this tool as well. So thank you.
Mr. Murphy?
I've got nothing.
Oh, you were on there again, sir.
Oh, I'm sorry.
okay.
My bad.
Sir.
I'm still trying to figure out how to work this white little box. Maybe I need.
Oh, sorry. We are good. All right. Well, I think we've covered pretty much everything. I appreciate it. There may be an opportunity for me to have to get back in touch with you. I would ask that we go ahead and get a list of all your statewide municipalities that you're currently partnering with. If you would also provide a point of contact at each one of those to help us better facilitate those conversations, then what I'll do is I'll share those with the board. I'll speak with Mr. Murphy, or maybe I'll just assign a few municipalities to each board member. It's not really my role, but it's probably the easiest way to do that, quite frankly, because they really can't have a conversation about selecting which ones. But we'll go ahead and give them a list, and obviously they'll call their own local and their own interests. But I do want to make sure that we get bandwidth and we cover as many of those as possible. So thank you very much. I'll be in touch with you. I appreciate you being here today for the presentation. If there are any subsequent questions that board members submit to me over the next few weeks, we will definitely bring those to you so you can go ahead and provide that response in a timely manner.
Thank you so much, sir.
Thank you. Great job.
Thank you to everybody on the board for the time today.
Board members, next up, we have Linda King, Senior Director, who's here to share with you the group plan update.
Thank you very much. Good morning, everyone. Okay. Well, good morning, Board Chair Allen, Superintendent Hyde, members of the school board. We're pleased this morning to bring you a preview and update of the school board's new health plan for 2025. And what I'm going to do this morning is introduce our new health plan partners, talk a little bit about an update, the health plan performance. We've had some updates to that I want to give you a preview of. Talk a little bit about our health plan strategy and introduce the new model as well. All right, our new health plan vendors. I'm excited to introduce that we have new vendors. Quantum Health will be doing our, actually handling customer service, concierge navigation, and clinical management and oversight. And they are new. That is a new service. Manatee County Schools, to my knowledge, is the only one using navigation in Florida. So we will be the second school district to be offering that. Meritain Aetna, which is an Aetna network. Meritain is a self-insured arm of Aetna. We'll be doing our claims administration and network access. And Welldyne RX is coming back to Polk Schools, and they'll be handling our pharmacy benefits. And Aetna Resources for Living will be continuing on as our employee assistance program. And then RX Connection is handling our PBM auditing, that's our pharmacy benefits management auditing, and performance monitoring. They are new to the team. They've already shown great value. They've already done a preliminary audit of what Prime had done with our diabetic program last year, and they've already found discrepancies for us, which we think will result in some reimbursements for us. And they were already pivotal for us as far as what they set up for our RFP, which resulted in actually some very good language for us as far as our rebates and terms for the school district. All right, an update for you as far as our planned performance. If you remember, when we came here in March, we gave you projections as far as how the plan was performing. And I wanted to give you some updates as far as that was concerned. And to give you an idea of where we stand, if you remember, I'm sorry, thank you so much, Judd. January to June, we were at a gain of $9 million. So we were doing pretty well. And all of this includes your RX rebates, your health center assessment, all the miscellaneous costs associated with the plan. And then in July, we were at a gain of $1 million. And then that included a $3 million prescription rebate, okay? And those rebates come in like every 6 months or so under the current arrangement, so they come in pretty slow, but they can come in lump sums like that. Now, August. You know, the summer is when we get a lot of our claims. In August, we saw some catastrophic claims, and actually it was pretty high, and one of the highest I've seen, I'm sorry, excuse me. And $16 million, and what that amounted to was just a large group of claimants. And so the concern was we were actually getting ready to prepare this presentation. So one of the concerns was we went back to the actuarial consultant and we said, let's take another look at this, because we want to make sure this is, are we trending up again? Where are we as far as our claims and our reserves? So we went ahead and took another look at that. And so we had a $5 million loss is what we're looking at, but so we've got a lot of large claimants. What we had were, and it was all over the place. We had, a couple of preemies, so it was a lot of combination of things that we had. And you are going to see that periodically. Obviously, you've got premature babies, those sorts of things happen. We had a claim that was actually filed late, that we think was an audit that was actually filed late, which does happen as well with our current arrangement. So just a lot of large claims. So year to date, we're still at a positive $4.6 million. Okay, here's where we are with the claims, our large claimants.
Linda, if you.
I'm sorry, yes,
Go back to the previous slide, please.
yes.
Could you please explain why the July revenue was significantly higher than the August?
Yes, I can certainly do that. That's all the holdback, sir, that's put in. So we always look high in the summer because of all those holdback payments. So it is always inflated in the summer. But by the end of the summer, it ends up equaling out. But that's how that's happened.
Just for transparency's sake, so that everyone understands, especially those who may be watching from home may not understand that specific term. Holdback is a process the school district does in order to ensure that our employees receive benefits and payments over 12 months. And so there's a portion of each paycheck that is basically saved or held back in reserve to cover those costs. So I just want to make sure I define that term for people who may be listening.
Yes, sir. Thank you for pointing that out. But absolutely, that's what happens, is that money actually, the contributions and deductions are taken out of those payments, and they actually fund benefits over the summer months. Okay, so here we are looking at our claims over $150,000. Total paid from January to August, you see 58 claimants. And actually, although we're trending higher, we're not as high as we were in 2022, which is the good news, because we don't want to go back to that bad year again. So we're actually trending lower than we were in 2022. So that's the good news. So 2023, we were at 80 overall. So, we're still, the average paid claim, you'll see there is almost 300,000. You were at 305 a little bit in 2023. You're going to see your top 5 claimants there overall, your total paid claimants. So you're at 17.3 million so far this year. So your trend overall, you're going to be a little higher than 2023, but not as high as you were in 2022.
Hang on a second. Ms. Fields?
Yes, ma'am.
Thank you. I want to go back to the health plan performance, and you referenced a couple of premies. What else? What other types
Yeah,
of claims do we
we've
have?
got a lot of cancer cases, which again, we're going to talk in a little bit. We've got a lot of cancer that's tied to obesity. We're going to talk a little bit about obesity in our population. You know, we're looking at solutions overall, but, you know, part of what the goal of the Health Strategy Committee, as you know, this year we talked a lot about having to change the partners we were with and what we were doing about obesity overall. And we'll be looking at some solutions. But we really have to get employees engaged in their health overall, and then we have to provide some solutions. So, but yes, we've got a lot of cancer. And we know that the metabolic conditions overall, we're getting chronic kidney issues tied to that. We're getting other cardiac issues. So what we're seeing overall is a manifestation of all of that overall as people age. And also the joint issues as people age. So we're seeing all of those issues.
Thank you. No further questions.
Okay. Okay, so you've got some updated, also I want to remind you too, one thing that I talked about with our CFO is we also, as a reminder, we didn't have any updated, we didn't change our revenue this past year. So there was no updated, as you remember, Superintendent, there was no increase in revenue. The school board didn't commit to any additional revenue. There was no increase in premium. So this is where we ended up. The good news is, even with the increase in claims this year, we're still at our 60-day reserves, but just barely. So we're hanging on. So we're at 60 days, which is where we need to be, but we need to be real careful as we move forward with what we're planning for, because that's where we need to be. That's where the state expects us to be as far as, and the 60 days is necessary as far as claim payments. Okay, now we did a good job with our RFPs. We did commit to some changes as far as our benefit program, but you know the experience with our new partners still is really still to be tested, right? We did negotiate savings and reimbursements, particularly in the prescription plans. We're anticipating a minimum of $3.2 million in savings from the RFP, which is awesome. We could actually see more than that. But, you know, that's still to be seen. So $15 million is where we are right now, but some of the days are based on claims, as I said. So in 2026 is the concern. We're at 24 million here in 2025. The concern is going to be 2026. So as to where we are.
Ms. King, one moment. Ms. Miller?
You're talking about savings right now, so I'll
Yes.
try to jump in. I have a few questions. And for someone who sat on one of these committees, luckily I had a little bit of a background in insurance because it's a lot to take in if you haven't had that. I just want to talk a little bit about, first, I was surprised to see delayed claims filed as late as they were. I was not surprised to see higher claims in the summer where people have kind of surgical procedures or the high dollar things done when they have time off work. So that kind of made sense to me. I appreciate that we're still with that 60-day reserve. I think we could have, I think if we talk about how the process will change, and maybe you can allude to this a little bit. We've had a consultant for about 20 years, and I know we've sent that out for RFP. Can you talk about what's required of that consulting company, what they've done in the last 5 years to bring us contracts to review or to find savings? Where is that? Because as a board member, I would rely on the consultant to be able to help find those savings for us. It was interesting to watch our last company change direction on a couple of things when they figured out we were going out for an RFP. I was offended at that. Had they never felt the heat before? Why was it taking the RFP to get them to change direction on some of what they were doing. So if you could explain the process for the public and the employees that are listening, because those meetings, everybody doesn't get to take part in, and they are layered with information. And I want to make sure that if we continue with the consultant we have, or if we get a new consultant, what the requirements are of that company to make sure that it's not us waiting to be in a deficit or waiting all these years to see a savings. What are they doing to go find the savings for us?
Well, the consultant can bring forward recommendations, but you have to understand that there has to be the will of the organization to want to make changes. My understanding, I have been here 5 years now, and I wanted to make a change 2 years after I came in. And I can tell you that there wasn't a lot of willingness at the time I came in to make changes.
From whom?
From the superintendent at the time, due to what we had. The concern was about, at the time, was keeping the status quo because we weren't paying salaries. So the concern was keeping status quo. So, if there wasn't a lot of, and then we were in a pandemic. So what are you going to do in the middle of a pandemic? That's not the time to go out and change your health plan because that's not the time you can go out to bid, as you all know. At that time, we actually added benefits. We added teledoc, we added a lot of virtual things because the concern was taking care of our people, right? So we were kind of right on the heels of that at the time we renewed. So I had to renew at that time. Now I renewed for the smallest time I could, which was 3 years. And that's the time we actually then were saying, okay, we're changing because we're tired of this. So I can tell you that it wasn't for, based on what I know of wanting to change things. It was just the willingness to want to do that by former administration. But
When we go into contract, will that be part of the contract, whether we extend what we're doing now or have a new provider? Will there be a piece in the contract that it's reviewed so often, so we're not waiting
Yes,
to
ma'am.
review? Okay. that was-
Typically we'll be doing, usually it's 5 years. There's always cancellation provisions in your contracts, on both sides, that the consultant can cancel, as well as the school district. So that is typically in there. So typically you have at least 3 years, if not, with a couple of years to renew. That's what we did with our health plan this year as well.
Not renewing, not going for the consultant, in the contract with the consultant company,
Yeah.
how often things will be looked at for savings.
Oh, okay. Well, that would be typically as the market changes, to be honest. I mean, we're going to continue to look at that. One thing this year that I thought was interesting is I had no idea, and I was surprised looking at my peers this year, that so many are still with large PBMs, and I was shocked at how many don't understand that what you need to be doing is mid-market PBMs. So I was really shocked at how many don't understand that they're getting ripped off, to put it plainly, because to be honest, so many are stuck in that large PBM, and they don't realize that they're basically not getting a good deal now. So they're not really on the cutting edge of what should happen out there. And we've talked about where a lot of the consultants right now, it's very difficult to get really a consultant that knows what they're doing and is really hungry to be doing a good job.
Okay, and I'm just going to wrap up. I have
Anyway.
these two questions. One, what do you, first of all, our providers, I think they know coming on that we're a large, we bring value being the size of district that we are and what we're paying. I don't know that we've ever held that as leverage. I don't like to feel that I'm at the mercy of the company that I'm paying millions of dollars to. It makes us very marketable. But what savings do you see in the next year or two with new providers?
With new providers, I really see us being able to leverage ourselves as the largest employer in our county. And I really see us being able to drive quality and price as far as in the marketplace. And I see the competition coming in for healthcare in Polk County and us being able to drive that for our employees. And I see it being a very unique time for us to be able to drive that and to be able to set up unique situations for pricing as well as care.
Thanks so much, Linda. And I just want to mention, have you made progress on these new people coming in, will be in network? Because I know we're going to have a lot of people coming into Polk County. I want to make sure that they're going to be in our network.
Yes, actually, Meritain is committed to going out there and actually looking at the folks that, for the primary care, I know where there were some gaps in the I-4 corridor, so they'll be taking a look at that for us to make sure that they're looking at that. We have time between now and January, so to make sure, and Shelley Wines is here with Meritain, so Shelley. So they will definitely, they are committed to making sure that they can get as many of those. And keep in mind that we are now, Aetna is now dominating the market in Polk County because we are the last large employer really to get the big part of Polk County, because they have Polk County and they have the Indigent Care Program. So now they have the school board. So they are going to dominate the network in Polk County. So that speaks volumes to providers. So that should give them good negotiating power out there in the marketplace.
Thank you.
Okay.
Ms. Fields?
Okay, so, Ms. Miller, thank you for your question. I wanted to say, and I'm not gonna be getting into no back and forth conversation on this, Superintendent Hyde, but I want to make sure that it's understood as it relates to the insurance issue. We've been dealing with this issue for a long time, long before the last superintendent of schools was here. One of the biggest challenges, in my opinion, has been that the majority of the board members did not want to have the staff to invest into the plan. And so as a result, the board kept having to add money to keep it in a decent way. And I think Superintendent Hyde basically said, we're not going to be doing that anymore. We're going to find a way to meet our needs, and we're also going to find a provider that will help us to meet our needs. Now, the interesting thing about our current provider is that at the 11th hour, when they realized that they were about to lose the contract, then a lot of the things that should have been recommended from them was not, in my opinion. And so it is what it is, but I want to make sure that it's understood. We've been dealing with this 60-day issue for a long window of time, and we have to keep our eyes on it very closely, because if we don't, we're going to be right back where we were. And Superintendent Hyde has already said that we are not going to be continuing to bring our dollars and balance out the plan. And so I just think there's a lot more to this than meets the eye. But I definitely don't want anybody to leave here thinking that the last superintendent is the one that wasn't willing to do anything about this plan, because that is absolutely not true.
Thank you, Mrs. Fields. I have limited perspective, so I appreciate that. So, because that was the only time period I could draw on.
Ms. Wyatt?
Thank you. Can you talk a little bit about the health clinics and just our usage of those? I get complaints all the time that they're not accessible, whether it's location. Specifically, lately, it's been the hours that they're open. They're not open hours that our teachers can get there. Or if they are open, we're not saving appointments after hours for people that are just checkup visits or things like that. Can you talk to me a little bit about that and what we're doing to rectify
We're
that?
well over capacity for that. Unfortunately, whether we didn't plan or we didn't plan investments in that, but we're looking at options for that. It's a little early to speak about what we're looking at, but we will have something hopefully for you towards the end of the year on what we're looking at with that, maybe some options for that. We are open 12 hours now in Lakeland. We've been able to expand that, and we can add a couple more staff members there that might help us there. But to be honest, we've only been able to add like 60 visits there. To be honest, we can only do so much with what we have there. And then, we're limited in space with what we have up in Haines City. The answer is we need more locations. And we are looking at options for that. Whether it be that model, a different model, we're looking at various. Everything's on the table basically now. That's what we keep saying. Everything's on the table. Because now Meritain said, Linda, whatever you want, we can do whatever you want. So I'm not locked in anymore by a contract that says you can only do this or that. Because before I couldn't do this and I couldn't do that because I was limited. Because I was locked into a contract that didn't let me negotiate something different. So,
So is there any opportunity to expand our hours at the Haines City location? Because that seems to be the biggest stressor right now.
I can check again. The problem is we have, the problem is our space. We're very limited in our space. We can perhaps see if we can look at maybe 12-hour shifts there. I can ask and see if that's possible. And see if we can add some staff there and see if that's possible. It'll take us some time to gear up for that. That's the problem. So it will still take us time, but I can see if that's possible.
Thank you.
So I'm sorry, Ms. Cunningham.
Wait till the end of her presentation, but everybody's kind of started questions. So out of respect, should we wait until the end of your?
I've just got a couple
Okay,
more than
I will
quantum.
wait.
Right away.
Go ahead and finish, and then
Okay.
I'll ask my questions at
Okay,
the
let
end.
me talk a little bit about the strategy, because we need to get members
I'm sorry,
engaged.
Ms.
Yes.
Cunningham, for the sake of your ability
Yeah.
to do that, I'm leaving your mic hot, so just be aware of that.
Can't start singing?
I just wanted to let you know your mic is still on, so I don't have to have you
Okay.
re-click. Go ahead.
All right, so we need to get members engaged in their health. We have so many people, we still have so many people that don't even go get their basic checkups. I don't know. I have to do something to get people to at least go get their checkups. And our cancer screening rates are low, y'all. And there's no excuse for that. Some basic cancer screenings are free. So we have to focus on that, because if we can catch cancer early, Cologuards are free. So Marathon is helping us, and Quantum is committed to helping us raise our, in this coming year, to raise those rates and helping get people engaged in that. We have to get people engaged in doing these basic things that we can do so that we can catch these things early. If we catch it early, we can save lives. And we know that we've had several cancers on the bus. When we changed our mammogram bus service, we did catch at least, I think, 4 or 5 cancer cases early. So that was wonderful. So we did change vendors because we weren't getting the access we needed. So I got rid of that one and contracted with another that was able to take care of us. So we've done that, but there's just more work to do with that. I talked about the multi-year administrative fees and guarantees we were able to get. We're going to look at point solutions that we need that are unique to handle our population. We're going to be talking, we talked yesterday with the Health Strategy Committee about inflammatory conditions. We have a huge problem with inflammatory conditions, be it Crohn's disease, be it psoriasis. All those specialty pharmacies are huge costs for us in the millions of dollars. We've got some programs with Welldyne we can explore to look at lowering that cost and using biosimilars. So we'll be looking at those sorts of strategies that we can do. We're going to be looking at the diabetic program. We need to be modernizing it. Our own physician says it's not working. It needs to be touched again. It's not following some of the basics. We have people that are still in the program that never graduated, that their A1C is better than mine, and I'm not even diabetic. So we need to be moving people out of there and getting people, getting more room for the pre-diabetic people. So there's things we need to do to modernize those things. So we'll be looking at all those things with the Health Strategy Committee, as well as doing future RFPs for dental, vision. We got a lot of catching up to do with those sorts of programs, including the EAP, all these things that need to go out to bid that are overdue. So with that being said, I'll move on. And next I want to introduce, so I don't know, Mrs. Cunningham, if you want to offer your thing before I introduce our new branding and my new partners.
That would be great. Thank you so much, Linda. Okay, so having been involved with the health clinics for all these years, we opened the very first one in the county in Haines City, and it is doing very well. And they provide great customer service, I might add. So my thought is, I'm hearing rumors that one is going to close and that we're going to
Our lease is up.
to
Our
move.
lease is up in 26. So yes, it has to. Our final lease is up. So we're probably going to have to find another location for that.
Okay, so my request is that something be found and be done on the east side of the county. I know the rumor mill up there is something, there's a site in Auburndale, I guess, that would serve the central part of the county. And all I'm going to say is, on behalf of our constituents, when you have people that travel as far as Point Siena, Haines City, and the like, I really don't want to see us close Haines City to move it in the center part of the county, and then the east side, once again, doesn't have any type of help that it needs for all those employees. It's the fastest growing area in the county. So I understand the lease is up, we have to do some things, but what I'm asking us to do is if we're going to look for additional places, is to, you can open up a second one or a third one, but I don't feel we should compromise what we've done in the greater Haines City, Davenport area to provide first line of defense, if you will, for healthcare for our employees right there in the heart. It's, you know, from someone in Frostproof to have to go to Auburndale versus up to Haines City's a wee bit different. Somebody from Point Siena, it's huge. It adds time, it adds energy, whatever. So I understand contracts, I get it. But at the same time, I don't feel that we should totally abandon that area. I think there's some sites available, and if not, I think we reach out to our developers and we say, here's what we need, and put a site someplace in the northeast area of the county so that all of our employees on the east side have access, just like the brand-new facility was done on the west. And then if there's finances and money left over, or financially we could infuse dollars to put something in Winter Haven, Auburndale, okay. But please, please, don't close something in the east side of the county to put something in the central part. Once again, I think that's being very disrespectful of our employees and those people that work there. Talk to some of the girls and the guys and where they live. For them to now go from living where they live and providing the kind of quality care that they do to have to go now another 20, 25 miles due west it's disconcerting. And so I wanted to bring it up today. I'm a short timer, but it's something near and dear to my heart because I opened the first clinic in Haines City there. And no, I can't say that it's perfect. Everybody's got it, whatever. But there's always the opportunity. I know we don't have radiology, but there are partners that we have that provide that for our employees, me being one of them. So I just think, I implore you to not just shut the door in Haines City and move to Auburndale or Winter Haven. That's all I'm asking. Please evaluate it.
I think we'll be looking at other options other than that one.
Someone's coming to the podium. Thank you, sir.
You are hearing a rumor.
Yes.
We are looking at multiple sites. We are not abandoning the Northeast.
Okay, well then somebody needs to say something because that staff is scared to death that they're going to be moving and they're going to have to drive to Auburndale is what they've been rumored. I'm sharing with you what I hear, and I told them I would try to let the powers to be know, and I thought, what better than a public meeting?
Well,
So-
I'm glad you brought it up so we
Yeah.
can stop that rumor.
Perfect.
In public.
Okay,
Yes, those staff will be leaving that building. We will not continue that lease.
I
But
understand.
we will not abandon the Northeast. And our goal is to open as many clinics as we can. and
Right.
Have the funds.
Because when we looked at, even in the beginning, the rate of return on the investment of having a first line, of healthcare right there in the community where everybody can access it versus immediately going to we've saved, I don't know what the dollars are, but I know in the beginning they were incredible and they've only gotten more. So
The issue is, we just had a lot of maintenance issues associated with that center.
I understand.
So,
I understand. Heard about it in leaks. Yeah, I'm there. So thank you. I respect your opinion. Just please be careful. Secondly, in looking at the paid claims and the information, our performance, and I understand there's been exceptional medical and prescription expenses in August, and we're behind the eight ball. But I do think it may levelize out before the end of the year, so I don't, okay. Because I think a lot of what you explained is probably true, because people have procedures and things done, probably in the summertime when they can, and they're off of work or partially off work or whatever. So I hope and pray that we can continue, because that is a benefit that we offer that is very attractive to incoming and retaining employees.
well, and I really hope that our partners, that what we put in place is really going to, but again, the engagement,
Right.
that's going to be really key, because our people are still our people.
They are.
So that doesn't change.
No,
We
ma'am.
still have the same people that we're covering, so,
And let me just say thank you to you and your staff.
thank you.
Very, very seldomly do people call and say thank you. It's always, oh my goodness, help me, I have this, I have that, me included. And so publicly, I just want to thank you and your incredible team for all the work that they do dealing with all of our employees with every kind of situation under the sun. Everybody should be applauded, and kudos to your entire team for
Thank you. They
all
are,
that you
they
do.
are here today, so.
You want to
I
stand
wanted
up and be recognized? Yeah.
I want to recognize them because I asked
Yes.
them to come today
Yes.
because they do work hard
do.
and they are wonderful as far as they take, like you said, they take the good and the bad. So I do appreciate them. They're great. They're a great team.
That concludes my question, Superintendent Hyde.
Yes, ma'am. Ms. Miller?
I forgot one of my questions, Linda. Sorry, you're probably glad that I did.
It's okay.
It's a good thing. I have,
You'll send it to me later.
I will. I apologize. I am the person with questions. It gets me in trouble sometimes, but
It's okay.
I do want to point out that two things. I think I might remember the first one. But sitting on the committee and looking at the diagnosis of this district, morbid obesity is a problem. It is a significant problem. Heart disease, the top 5 diagnoses we pay are all, they're all related to weight. The ABCs of diabetes is not fiscally taking care of itself right now, and I know that you're looking to revamp that program, and I appreciate that. We have employees doing all kinds of things on their own. We have people ordering compounded medications because that's the new thing. I want to see us, and we talked about it all year long, and then Blue Cross Blue Shield came in and said, yes, we have a great solution for you because you're asking us to leave. But we have got to start looking at the newer products for this. We are not going to be able to pay for this on the back end as far as the increase in diabetes, the heart disease, the heart attacks. I was shocked. I was shocked the first meeting when I saw those results of what our district is sick with, because most of it is preventable. I do want to, so I am, hi Maritime. I would, like, we have got to move forward on preventative medicine because we cannot keep paying for this in the back end. It's way too expensive. Cancer is another thing. When you showed us the data that colon cancer, the screenings are practically none. This is where I was going. Marketing. I said this in the meeting. Having a background in PR, I have staff members that have no idea about the mammogram bus. They have I don't know if we need to partner and come up with creative videos. We've talked about this. This is a monthly, weekly conversation about going to where people are for their information gathering. That's why we had this provider come earlier to talk about that. We have got to get this out to our employees. If you're saving people's lives with these preventative screenings and they're free and they're not taking advantage of them, how do we meet them and how do we message that so that they will? I'm glad that you reported that you did catch some of the cancers early on the mammogram bus, but colon cancer is a leading killer that we've got to prevent. So I think messaging and working progressively on adding things to a formulary that will help people and I'm not paying and we're not saddled with the cost of these diseases that are prevalent in this district. But I do appreciate the work. I'm glad you brought your team. They had to sit through all of our work session, but
It's good for them to see what
what's
you all
out here.
do. Yes.
And I know this is where you might have felt my frustration in those committee meetings. This is a long process, but it can't be slow. It can no longer be slow. So I'm looking forward to what you are going to bring to us and what your new providers will bring. Thank you.
Thank you. Yeah, I think the work, we had some great discussions yesterday, but I think a lot of this, the reason I'm going slowly and some of these things is the concern for the finances. And I brought that up when I talked to the Health Strategy Committee yesterday, is the concern with the avalanche and looking at the experience of a couple of my peers when they opened the GLP-1 floodgates without a BMI circumference, without a lifetime maximum, without a cap. You know, it was like they had to shut the gates because they were hemorrhaging millions of dollars in costs. So Dr. Agee has some thoughts around that. So we had some interesting discussions. Her thoughts are a BMI of 50 because her thoughts are we have a BMI of 50 all the way up to 75. I know it breaks my heart thinking of a BMI to 75. We were talking about adding Lantern, which used to be known as Surgery Plus yesterday. The Health Strategy Committee did vote to add that yesterday. It's billed as a claim savings, 2-to-1 guarantee on costs. They're with in bold, it's quality initiatives. So we'll be, I'll be bringing that to you, Mr. Murphy, because it's a state contract. All my peers already have it in place to add that, but it's quality initiative, but it'll be a zero cost to our employees to get that in place, but for surgeries, right? But they want to look at bariatric come April. But again, looking at that, because there'll be a cost. So again, can we afford to add that? But to your opinion, and Dr. Agee's, is that maybe a good, not one solution works for everybody. But I was amazed that we are not using our dietitian that we are paying for in the health center to her fullest. We are not doing a lot of education about proper eating. And that is key. We can do all we want to do with GLP-1s, but if we're not teaching people to eat right, you know, we're missing a lot of the basics. So there's just a lot involved with this. And so.
Data, Blue Cross Blue Shield brought in data that said 3,800 employees qualify for these new treatments, but only half of that would take advantage of them. And I believe in your historical knowledge to talk about fiscal savings.
Yes.
I am not, start talking about surgicals, that's a lot.
I know.
And this is a long conversation that can be had back in the committees. But I can tell you that putting barriers around anything is important. Putting barriers around a diabetes program where nobody had to graduate out of it, that didn't help us fiscally. So anything we bring in would need barriers. Can you just answer one more question? What would have to be bargained? Would bringing in, and secondary marketing, the dietitian needs to be marketed, in my opinion. And also, we don't have any more room for foot traffic in these. She's going to have to do it virtually or whatever you guys can come up with, because we can't get our own appointments, much less adding appointments for those things. But if you can speak to what you would have to bargain to put certain parameters around, whether it's a higher deductible, a lifetime limit, does that stuff have to be bargained? Can you explain that?
My understanding is any change in any copay, this is what I've been told, any change in any copay, any change surrounding the terms and conditions of any of those benefits has to be bargained. That's what I've been told.
Thank you. Because that plays a factor in timelines.
That does, very much so. And bargaining starts in February, and I've asked the executive team to start as early as possible, because that's where we have to get to the bargaining table with these things.
And I appreciate you talking about parameters for somebody who lives in disability world. When we turn on the faucet for therapies, we run out of money. And so I think you probably are already studying that, but I'm looking forward to your solutions that you're going to bring on that angle. Thank you.
Thank you, ma'am.
Dr. Allen?
Superintendent. Just two things, just a continuation of things that I've brought forward in the past as it relates to that Health Strategy Committee. I try to monitor that folder that we have access to. I would love for that data to continually be updated. For example, meeting minutes, right?
Yes.
Who was present in each strategy meeting? So when I go back through this last year, from my perspective, there's holes, right? For me to be able to track the progress of that. So just would nudge us that way more. And I know all board members have access to that shared folder, and we can see the progression there. Secondly, I mean, we're going through change, right? This is a massive change. Our employees have been comfortable in a sense with our health, and I think the superintendent he sent the email out regarding AFSCME this week, and there's no change, right, for this next year is what was noted in the email. So any communication from you and superintendent that this is a good change? I'd like to hear that. Are we confident? Because I think our employees may feel uneasy about change. So any feedback in that area would be appreciated.
Okay, well, and I apologize, but my secretary is out. She had a death in the family, so nothing's been loaded from yesterday's meeting, but we do have notes from that, so we'll be loading that as soon as we can for yesterday's meeting. So, and I'll have her go back, but she's fairly new to the team, so, and take a look at that for you and see what we can do to get that straightened out. So, But as far as any changes, we are working with Quantum real closely on the frequently asked questions we've already gotten in anonymously from employees. And the emphasis this year is really just talking about our branding. We've worked already with public relations on this. The emphasis is rebranding the health plan and talking about it being our health plan, their health plan, meaning my PCPS health plan, that it is theirs and its ownership. So not really looking at it being Blue Cross Blue Shield or Aetna. That's where they're going to go for their network. And that it's really a partnership between PCPS and Quantum, because Quantum's going to be their one contact that they call for everything. So they're going to get an ID card and it'll have that one phone number on that they'll call for that. But really that it's the same health plan they've always known. Co-pays are going to be the same. The only thing that will change will be the network. But to be honest, it will look and feel the same. And their doctors, to be honest, we are working on the network, but it's very, very close. It was like 98%, 97%, something like that. It was very close, if I remember correctly, as far as that's concerned. And they will have that access. Quantum is going to talk a little bit about the transition, but they will be opening the call center December 1st for our employees to call into. So they'll have access to that December 1. And we are going to be out during open enrollment, and they'll be out with us. So they'll be available to answer questions and to talk about the transition. Okay. So right now I wanted to introduce the folks that are here with me today. I've got David DeLong with Quantum Health. David. I've got Lindsay Cadam. Cadam, okay. I'll learn it eventually. Okay, and then Shelley Wines, I already introduced her. I've got, Jan Bush with Robinson Bush. And then I've got Andy Edwards. He's the head of sales with Welldine. You may remember Andy. And then Alba Sostri is my senior manager. So, and you met the rest of my team. So with that being said, I'll turn it over to Quantum now. So do their part of the presentation and talk about what their introduce you to Quantum.
Good morning. Thank you so much to the board, all the attendees, the benefits team that has been incredible to work with. My name is Lindsay Gatcomb. I am a client manager here at Quantum Health. I'm accompanied by Dave DeLong, who's client executive. We've been working really closely with your benefits team to prepare for 2025. I can't believe I'm saying 2025. And how we can best support your employees and their family members. I think it's safe to say that when navigating healthcare, it's a confusing process. Oftentimes, people do not know where to start, and that hinders them from even getting the care that they need. So we are here to make it easy, simplify that experience for them, and help them navigate the healthcare system as easily as possible, ultimately saving them money as well as the school. So today I'm going to talk a little bit, about what we do at Quantum, how we work, how we help employees and their families, and then how they can connect with us to get the care that they need. So I always like to start with our mission because it really is at the core of what we do. It is the why behind what we do every day. We are a team of really fast-thinking, forward-thinking individuals that are focused on navigating the healthcare system, making sure that members, clients, providers feel that they are supported throughout their healthcare journey. And that's because we take on the hard stuff so that they don't have to. We created the healthcare navigation space now 25 years ago. And it forever really changed the healthcare experience for millions of members that we've partnered with. you want to go to the next slide? I don't think this video is going to work, but the long and the short of it is that we are here to help. We are here to answer questions. We are here to guide them to high quality care. We are here to help them navigate their ecosystem. Oh.
Navigating healthcare and benefits can be complicated. Quantum Health is here to make it easier. We provide one place to go and one amazing team to help, so that you don't have to navigate your healthcare journey alone. We're a group of benefit experts like me, Sarah,
registered nurses like me, Jody, and claims specialists like me, Jackie. Our unique service is part of your benefits package. Think of us as your own personal guides, here to help you and your family with your benefits and healthcare.
We'll give you the support you need while saving you time and frustration.
We'll work with your doctors and your insurance company to help you with all of your needs, from understanding your treatment plan to solving your most complex billing issues.
And we'll do a whole bunch more in between. In other words, we'll take on the tough stuff.
Looking for a doctor in network? We'll find one. Need to confirm coverage for an upcoming procedure? No problem. Having trouble getting that prescription filled? We'll make it happen.
Get an incorrect medical bill? We can help. Wondering if there's a way to save on costs? We'll explore.
Even if you're just unsure where to start, there's no question too big or too small. We're here to help you when you need us.
Call us at the number on the back of your medical ID card. Chat or message with us on the Quantum Health app, or connect with us online to schedule a time to talk.
There's only one place you need to go for your healthcare benefits, and it's right here to your team at Quantum Health.
I'm here to help.
Estoy aquí para ayudar.
I'm here to help.
I'm here to help. We are all here to help.
All right. So as it was highlighted in that video, we're really here to help with medical claims, benefits questions, prescription questions, and so much more. You can expect expert guidance from our care coordinators. We're just a call, a click, a message away. So we have partnered very closely with Meritain, Welldyne, as well as the additional benefits partners. And you'll see on this slide, I've divided out, where each partner plays their role. So Meritain does still process the claims. They are still the ones that are receiving those claims, paying those claims, but members will still contact us. Providers will still contact us. If they have questions about eligibility, they have questions about their coverage, they'll still contact Quantum Health. Same with pharmacy benefits. So Welldyne will be the pharmacy benefit manager. They will manage, the prescription claims processing, the negotiations with pharmacies, manage that formulary. But again, if members have questions, they will just contact Quantum Health. And then we also work with the additional benefits in the ecosystem. So things like Embold, Marathon Health, Delta Dental, Teladoc. We help guide members to these resources. Oftentimes these resources are very underutilized, and that's because there's a lot within the ecosystem and it's hard to know what is relevant when. So we'll find opportunities to refer members to those additional point solutions.
All right, and Dave DeLong here once again, but just to kind of review here, so I know we talked about the ID card, and it seems simple, but it is really important. So there is that one number on your card. Your members should never be calling Meritain, they should never be calling Welldyne, they call Quantum. We are your one-stop shop for all things benefits. So when we look at the ID card, I kind of like to tell this story about my wife. First time she called Quantum, and I kind of figured I wasn't doing a good job of explaining what I did, because she said, I need a dermatologist that's in network. I said, well, good thing is I work for this great company called Quantum Health. Let's call that one number on the back of your card. She called, not only did she get that in-network dermatologist, they also said, hey, Jen, it looks like you're due for a mammogram. Let's go ahead and set you up to some of these in-network providers to go ahead and get that accomplished. It looks like you also don't have a primary care physician designated. Let's go ahead and send you a list of in-network providers within 5 miles of your house. So that one call turned into 3 really good healthcare decisions. And I know, Lisa, as you had spoke earlier, getting these members to, just helping them walk through the door essentially is really what we're here for. And I think that's the big value of that one number to call. On top of that, the providers are calling into Quantum. So through us taking the benefits calls from those providers asking, they're reaching out for benefits on a member as to what, I think we have as to what may be available for whatever procedure it may be, let's say. Well, we get that call and we find out that provider's not in network, or we're getting that information about a procedure that would lead to maybe a cancer diagnosis or something along those lines. That's going to flag our clinical side to reach out to that member directly. So we're able to walk them through that journey before they make before they have that month of $1,000 in paid claims. We call that the trigger month. You're going to make a certain amount of decisions in that time period. Well, without somebody to kind of walk you through that, you're doing that on your own, right? So us taking those provider calls, and I know a lot of clients will tell me, okay, you're taking provider calls, what does that mean? Well, that means we're getting access to that information well ahead of time. So we can really do our best job of making sure that your members are prepared, know what questions to ask, know what to expect before those meetings go with their provider to make those decisions. And that's a lot of the value that we're able to offer with, that simple one number on the ID card. All right. Speaking of our care coordinators, so they're placed in what we call pods. Pods are a group of anywhere between 30, 35 care coordinators. These are folks who can help you with anything from claims. You have an EOB you don't understand. You have a claim come in that maybe seems overpriced. If you want to find out, like I said, if there's a provider in network, anything you really need, you call into them. They're set up in a way that they're literally at arm's reach from a clinician as well. So they're kind of set up strategically in groups of 4. Each of those groups of 4 has a nurse within that group of 4. The pod is, like I said, around 30, 35 people. Also set up with a pod that will be exclusively working with Meritain. So every TPA, every carrier has its own little nuances. So we want our folks as well versed in the TPA that your members are going to be working with. They can help you with, like I said, anything from claims issues, replacing that ID card, finding an in-network provider, or just if you have a question. I mean, I encourage folks to just call in. If anything benefits related, or maybe you saw something or you overheard a coworker talking about Teladoc, you can call into Quantum and we'll let you know how that works. We're going to guide you to that. We see 2 times the usage of point solutions than with clients that don't have healthcare navigation. So all those benefits that you're paying for your members, we want them to use them. You want them to use them because they're going to save you money and save them stress in their healthcare journeys. Speaking of the app, calling in is not the only way to get a hold of us. We have a newly renovated app. You can access your ID card, you can chat with a care coordinator, you can check your deductible, really anything related to your healthcare will be on this app. It is one click away. We still see a lot of folks, the majority of folks calling in because it's your healthcare and it's your dollars, and those are probably the 2 most expensive, most important things to most folks. But it is a very user-friendly app. We will see a lot of engagement. I personally work with another school district within the state of Florida, very high engagement based on my book of business against other clients. You're gonna see high levels of engagement, and I think we will be able to push them to, as some of the concerns were, those preventive screenings, those primary care physician visits, the basic things, the blocking and tackling that we all should be doing with our own healthcare. But the app is just another way to access that. And sometimes we might call you. We wouldn't do it if it wasn't important. That's when we get our claims in, right? We have different claim feeds from the PBM partners, from our TPA partners. When we stratify your members through our clinical program, if there's something, it may not be necessarily high dollar, it might be high risk. And we say, okay, this person needs a call out. We have folks on staff that will literally call those members until we can get a hold of them and then connect them with a nurse to walk them through their personal healthcare journey. You know, another reason is, you know, there might be a problem with your prescription. There might be a situation where a program we have called Site of Care, where a lot of folks aren't aware of this, but, you know, if you have a family member or anybody who's had infusions done, the place in which you're getting these infusions really determines the cost, which sounds kind of odd, but what we found is if you're getting infusions in, say, in inpatient or in a hospital setting, it could be 2, 3, 4 times as expensive as an outpatient facility or even a home infusion situation. So we have about 100 NDCs, so drugs, infusion drugs on our proprietary list, that when those claims come through, it's immediately flagged, sent to our pharmacy team, and they can figure out, okay, what place is this member getting this infusion, and can we find a less expensive option, and generally a more convenient option, because the more expensive ones aren't generally convenient. I don't want to go to a hospital to get an infusion. I don't want to have to deal with the parking. There's MRSA. There's all kinds of stuff with hospitals we don't like going. So at the end of the day, you know, we've seen great savings. I think we saved our clients something like $25 million across the entire book of business last year with this. I personally had a client who paid for their whole year with Quantum with this. And I do imagine we will have quite a few with this group. I can't, hopefully nobody's getting infusions, but that's not realistic. So I'll go ahead and on to the next slide.
So respectfully, I'm going to ask how much more you have. We were not provided your slide deck in advance, so when we calculated time for this, and I'm going to have to give the board a break here in a few minutes, so I'm going to put you on the clock. You got 5 minutes. So.
This is literally the last one. So if we want to watch, I think this is a pretty good video.
Okay.
Did you just touch the button?
Just.
Okay.
I went to the doctor for a medical test I thought would cost me nothing out of pocket. Then I got a bill for $4,500. I wasn't sure what had happened, but I knew I couldn't afford that bill. I called Quantum, and Alana was kind and patient with me. She told me she would look into it and find a way to help. She sure did. She figured out the problem and got the whole bill erased. I was worried sick for days, and Alana took care of everything in just a couple of hours. What a wonderful young woman and a wonderful service you all provide. Thank you. You are above and beyond. From Doris.
I started my cancer journey 6 months ago. My care coordinator, Michael, has been there the whole time. He's very helpful in answering my emails, getting procedures approved, and always having kind and supportive words for me. I don't know how people do this alone. Thank goodness I don't have to. Michael truly is a godsend, above and beyond in every way. From Mike. Wow.
Insurance is so confusing. Luckily, there's Shantice. She is so awesome that I just had to tell you about her. She is friendly, funny, smart, and kind, and an A+ person. She helped us understand some really complicated stuff. What an awesome service, above and beyond. Thank you. From Jamie.
My wife needed surgery, and we didn't understand what our insurance plan covered. We were so frustrated until I called Quantum. Drake helped me tremendously. I had a lot of questions, and he answered them all. He was kind, professional, polite, and friendly. He was the best customer service representative I have ever worked with. Thanks for going above and beyond. So sweet.
When our son was diagnosed with type 1 diabetes, we were shaken. But from the beginning, our Quantum Care coordinator, Scott, has been in our corner. He has helped us navigate months' worth of complicated claims and authorizations. He's made our hard time easier knowing that we can count on him to help us with anything that comes up. He genuinely cares and always goes above and beyond. Thank you, Scott. From Jasper. Wow, that was great.
Helping you is why we're here.
So whether you need help understanding your benefits,
Getting procedures approved,
Accessing prescription medication,
getting care through ongoing illness,
or navigating your healthcare journey in any other way,
we're here to do the hard stuff.
need help, contact me.
contact me.
Contact me.
contact me.
Above and beyond, it's where we go for you.
So as you can see, we take a lot of pride in what we do at Quantum Health. We are available for your employees and their families from 8 a.m. or 8:30 a.m. till 10 p.m. We understand calling during the school day is just not feasible. Coming from a family of teachers, I know how that works. So if they need any assistance with their healthcare benefits, please direct them our way. They can visit the website, which is mypcpshealth.com. Call the number, the toll-free number that is listed here, and they can also download the app. Starting on 1/1, they can download the app. So really excited to work with you. I appreciate all of your time today. I'll go ahead and turn it over to questions.
And they can also schedule an appointment on the app, so if they don't have the time to make the call during the school day or at lunch, we can call them back.
So there are no questions currently. Happy to bring you back for the subsequent workshop if we need to. I know there will be questions after this. I have questions and comments, but I'll reserve those for the next meeting. And so we appreciate you being here with us. And Linda, just so you're prepared, for the next workshop, I would like to see a timeline and strategies being used to communicate all this to our employees, what the full marketing campaign and strategy is going to be. As Ms. Fields and others have pointed out, our insurance issue has been a long-standing issue, and it's time that we respectfully got to stop talking about it. My comments about not continuing to infuse money into an insurance plan remain. I will not continue to do this because that's been our sole strategy to date, to keep it whole, and we've got to get more aggressive, and we have to get more intentional in how we're trying to do things differently. Clinics came up earlier as an example. As an employer, we only have 2 clinics, and yet every municipality has their own clinics, and there are other community-based partners that have their own clinics, and yet we've never sought to partner. And so there is an opportunity for us to maximize our ROI and their ROI by sharing facilities and sharing options. And so these are the things that need to be addressed and things that need to be looked at. Because again, we cannot continue to just infuse money into a plan that's not doing what it should be doing. And this is not about restricting access for employees, but at some point, the board and myself are going to reach a difficult decision. We're either going to have to start charging premiums, or we're going to have to be more aggressive in how we're providing health care to our employees. And there are plenty of options out there, but this is not something, it is a long-term process. This will take at least minimum 18 to 24 months. Why? Because you have to maintain your current health care provisions for your employees while you go out and look for other opportunities and make that transition happen. So this is a good first step. We're excited to see some change happening, but there are multiple other aspects of this that will be addressed. So thank you again for your time today. We'd love to have you come back. I'll work with Ms. King on that if we need to do that, but I'll wait to see what questions or comments or concerns the board members share with me over the next few weeks. We can bring you back to another subsequent workshop. Thank you very much. Board members, at this time, it's 10:47. I'm going to go ahead and give you a break. We will come back at 11:10.
You are welcome.
At this time, I'd like to call this meeting back to order. So Superintendent Hyde, could you work us through the rest of this work session today, please?
Absolutely. Up next is proposed rule development for school board policies. So we have Ms. Teresa Griffin, Assistant Director for Policy and Public Records. She's also joined by Chad Davis, Staff Attorney.
Good morning. Thank you, Superintendent Hyde and school board members. We have some policies before you today, and all of these policies are from the 2023 legislative session, so that session that happened at the end of 2023. And then over the next month or so, I'll start bringing you the policy updates from the 2024 legislative session that happened earlier this year. The first group are our professional learning and development policies, and these revisions are in response to just Neola's ongoing review of policy templates, as well as a couple of rule changes, Rule 6A 5.069 and 6A 5.071. And when you look at policies 1242 and 3242, there's new language that specifies the requirements of what must be in the district's professional learning system. And then there's some technical updates and revised legal references in 1242, 3242, and 4242. The next group is our anti-harassment and bullying policies. The first three, 1362, 3362, and 4362, are our different employee groups. And then 5517.01 is our bullying and harassment policy that relates to students. So they're updated based off Florida Statute 1006.147, which just states, the definition of bullying and that bullying or harassment of any student or employee. And what Neola has done now and what this does is it separates our employee groups from our students. So the employee policies, the policies that relate to employee groups now will only talk about bullying or harassment against employees. And then the 5517.01 is specific to students. So you'll see where students are crossed out in the employee policy and then vice versa. And then it cross-references those policies. Like in 5517.01, you'll see that it makes reference to all of the employee group policies, if that makes sense. Our curriculum development policy, 2210. And it's from Florida Rule 6A 6.053, and it talks about the District Comprehensive Evidence-Based Reading Plan, which is CERP. So it lists the requirements for that, and then it has updates about our approval and submission requirements, and also some new legal references. 2271 is our articulation and access to Florida college system institutions. And this is another rule change, 6A 20.007, and it just changes the name of that William Boyd grant. So you'll see that name change in the policy. There's also the result of two House Bills, 1285 and 1473, which just talks about our articulation agreements and dual enrollment courses and just requirements that the superintendent has if a dual enrolled student is arrested. So that straight from those bills, that language has been added to that policy. 5463 is credits from other schools. Florida Rule 6A-1.09442 is our process and minimum standards for awarding high school credit for CTE organization participations. And there's some language in there about the transfer of credits and how that works with Florida law. And it also references our CTE policy, policy 2421, which there'll be some additional updates in our CTE policy that I'll be bringing you, like I said, over the next month or so, some of the changes that came from the most recent legislative session. And then policy 8330 is our student records policy. And this is updated based on Florida Rule 6A 1.0955. It removes the language addressing transient or substantive threats and non-threats, and it includes a reference to the new Florida Harm Prevention and Threat Management Instrument. And then the inclusion of the reference to the Florida Harm Prevention Threat Management Model. And then there's some optional language that that has been removed in light of Florida Rule 6A 1.0955. And then the final policy is our wellness policy. And this is an actual replacement policy that's coming before you. A lot of the, what Neola's done is they're just trying to, they've been working with the Florida Department of Agriculture and Consumer Services and that agency's recommendations, and they're just trying to clean up the policy. And what we found with our wellness policy is this is a policy that's been in existence long before we contracted with Neola. Our wellness, there's a wellness committee that put language together for this policy, and when we started working with Neola, we kind of just took our policy and kept our language and then just made sure it had the components that Neola said that we needed to have in there. What we found over time is that a lot of our language that was put in there years ago is outdated language, and it makes it difficult when we're trying to add in or remove language based on Florida statute, because our policy was so different than the Neola template. And so what we've done, we sat down with staff from our, like Mark Wilcox Center, like physical education, nutrition, like they all got together and looked at our policy and then the Neola template and made sure everything that was in our policy that needs to stay is in the Neola template. And so that's why if you look at the wellness policy, it doesn't have the green and red strike throughs because it's an entire replacement policy.
Hang on, Ms. Griffin. Mr. Sharpless?
Sure. My questions are from just this last policy. You're discussing the wellness policy. And so after going through this, some of them I just have questions on. And so if you mind just going through the parts.
And I do want to say that that the wellness policy, we're not adding like new things to the policy. So a lot of like, it looks like, you know, all these options that are checked, it's things that were in our existing policy, and it just looks different. Like the way Neola laid it out, whereas ours may have been just like in paragraphs. Now it's like a check system. I don't know why I keep hitting the microphone. Sorry about that. So it looks different, but it's the same language, if that makes sense. But yes, sir.
You know, and I understand that policy is the guidelines that we give to the district in order to, you know, work out their procedures and everything else. We're not in the implementation day-to-day of all this stuff, but we are certainly giving guidelines. But I just have some questions on some of the things that are in there, if you don't mind me answering.
Yeah, and I'll do my best to answer those.
Sure.
Audrey Kelly, who was very instrumental in putting this together, is not able to be here today, but if there's anything that I can't answer, we can get those questions answered for you.
Okay, yeah. So going on to page 2, number 2, physical activity A, it says physical activity, and there's a shall or should not be employed as a form of discipline or punishment. So I was just curious why the should versus the shall on there.
Why they made that.
Yeah, why they made that decision. And again, if you follow up, if you don't know, just a follow up would be good.
Exactly.
Okay.
The reasoning behind that, but I can get that answer for you.
Okay. And then the next page on C1, I was just surprised that in our policy it says that we provide at a minimum, it says at least 10 minutes for students to eat breakfast and 20 minutes for students to eat lunch. I thought that was that is a very aggressive time schedule. And so again, that's not, we're setting the policy on that, right? I think, man, that's only 10 minutes to eat breakfast. That's pretty quick.
Right.
You know?
And that is minimum requirements by statute. And so that's what's in the policy. And that's not saying that we couldn't provide more. It's just this is the minimum requirements and statute. And so that's how we list it in our policy.
And so one thing that's really important to me is parental rights. And so one thing that I was just concerned with a little bit under C8, so that same paragraph 8, it says the school may provide opportunities for staff, parents, and other community members to model healthy eating habits by dining with students in the school dining areas. So it's by saying may instead of shall, to me that opens it up to schools would say, no, we're not allowing any parents to come in and eat with their kid. And that's just a concern of mine, and so that's why I wanted to bring that forward.
Actually, I can address that because that would not be the case.
Okay.
Ever since we exited COVID, our schools have returned back to welcoming parents in. There are some restrictions, though, about parents bringing food items for other students without permission from those parents. So there are some limited restrictions in that regard. But the use of the term shall is that they must do that. And there are going to be some circumstances, for example, I'm not going to require staff to eat with their children each day at lunch. That's an option for them. So that's why they went with the word may rather than shall.
Well, and to me, the confusing part is with the may, it's saying that you have the option to not provide that opportunity. Not saying it has to.
Again, procedurally, that's not allowed. That would not occur.
Okay.
Because again, as a district, we've made it very clear what the expectations are for allowing parents to come and have lunch or breakfast with their children and those types of things. But again, there are some restrictions as far as them being able to bring other students to a table where they're at or joining with other students without parental consent from those families as well.
And I understand that, but the policy can remain after administration could leave. And so it's just my concern that it's in there saying that we may instead of shall, we could potentially limit parental rights in the future. I'm not saying that this administration is. I'm just saying if we set that in policy, then that could happen. And that's my concern with that one option. So that was just, I just want to be able to express that. And the last one that I have is on number 14 on that same paragraph or that same item. It says lunch period shall be scheduled between 10 a.m. and 2 p.m. That's a really big window, and I know we have to be flexible. But having students finish lunch at 2 p.m. whenever the bell could be an hour later, it's kind of like.
And I think that was covering obviously all the different age groups. And so we have some schools that are in until 4.
Yeah.
And then some schools, that are out at 2. So they would have the earlier lunches. And then some of our middle schools that are in until 4 may have lunches that go up until about 2.
Gotcha.
And our current facilities, Mr. Sharpless, in many instances, especially in our older schools, do not have the physical space to add students to the lunchroom. And so they have to run multiple lunch shifts. So in order for them to do that, clean, reset, and then distribute food again, there's time. So it would allow it to go up to 2, but I'm not aware of any school that goes at that time for lunches, but I can certainly verify that.
Yeah, and again, this isn't me saying that we're currently doing this. It's just if it's in policy, it's a possibility, right? It's a guideline, and so that was a concern of mine. And that's all I have.
Thank you. I will get some of those questions answered for you.
Thank you. I wanted to circle back to number 8, where Justin was talking about the staff and parents and community members. Would there be an opportunity to separate those two? Because obviously, I totally understand we want to make sure that staff has the ability to have duty-free lunch. But I do tend to agree with Justin that just because this administration has great policies and is enforcing wonderful procedures doesn't necessarily mean a future administration will. So if we were to separate those two, where for staff it could be may, and then for parents and other community members it would be shall, I think that would give the opportunity to, because that doesn't say anything about them bringing food for other, it's just them being able to be there and have lunch.
Yeah, I'm a little worried about, I'm going to ask the board to reflect on this and propose some language at the next workshop then. I do not like the aspect of saying shall for community members. Because I won't be forced into that issue. Mr. Murphy.
Mm-hmm.
Oh, thank you. I concur with that. There are so many potential variables that I could not even fathom today where we would not want to be required under our policy to mandate that we have, what if the parent or what if the person that wants to come is legally barred or has impediments, or there are issues that for other reasons. My thinking in general, and again, it's your decision, but my thinking in general is that the superintendent's recommendations are well-founded. May is always preferable over shall, even though I understand the concerns. Procedurally, I'm hearing that we are allowing certain things to happen, but when you try to embake and adopt policy, I think the preference is always to do it on a more flexible basis, because there are so many different kinds of scenarios that you couldn't even begin to articulate that could potentially happen, or that the superintendent and his staff could potentially be faced with. So when you are given a permissive opportunity rather than a mandatory opportunity, in my mind, legally, that's better. It still accommodates what the board wants to see done, and you have a superintendent who is going to implement the procedures that the board articulates as a majority they wish to follow. But from my standpoint, and I would agree with the superintendent, if you're inclined not to, if a majority of the board is inclined not to move forward with how it's presented, there should be more study.
Did you have anything else?
I would love if you would be willing to look at how we could accomplish that, whether, obviously, if somebody's not allowed to be on our campuses, then they wouldn't be able to come to lunch. But I just want to make sure that in the future, we don't have a situation where.
I'm trying not to say a whole lot of things, but I'm going to have to say it. We have custody disputes. We have all kinds of issues we deal with. Here's what I would like to ask the board. I'd like to ask the board to give me some time to work with the team, because I think all we have to do is add a simple sentence at the end that will allow me, that basically the board says the superintendent shall develop procedures, administrative procedures, as to how schools will implement this, and that takes care of it, because now it is an admin policy and regs, or procedures and regs, and our schools must adhere to whatever we outline. So even if there's board turnover or subsequent superintendent turnover, unless there's actual action on behalf of those individuals to alter that, it's there, it's in writing, it becomes our way of work and our way of practice. Because even, I will tell you that when Mr. Sharpless, and when I first read it, he brought attention to one that really bothered me, which was the use of physical activity as a punishment. But I'd be lying to you if I didn't say I had to run a couple hundred laps as a football player in high school because I broke a rule. I was tardy to school, I missed a class, or whatever it was, I was late to practice. So let me think about how we best address, and we can just, I don't believe that students should be told, just walk laps because of X, Y, Z. But I don't want to take it away from our extracurricular activities and events, because coaches use that as a form of building a team, building character, building morale. I'm not saying it's the best strategy, I'm just simply saying, and we've had some instances where those have become problematic, and I think we've addressed those. So if you'll allow me some time to see if I can't work with the team to address that further, and then if the language is acceptable to the board, when we bring it back to you again at the next subsequent workshop, and then remind me, Ms. Griffin or Mr. Davis, if we bring back language at the next board workshop, would we have time to advertise it for public hearing in October and then adopt it in November?
So the policies that I'm bringing today, and then any that I bring at the next work session, we can't ask for authority to advertise until there's a board meeting. So anything that I'm bringing between now and our next board meeting will be advertised on the same date. So yes, we'll be able to bring back any language. We can bring back October 8th or October 22nd and still ask for authority that evening. It doesn't slow down the process.
Okay, and I saw Ms. Fields, you were on here, but I don't see your name any longer.
I agree with Mr.
Okay,
Murphy.
okay. Okay. Thank you.
Thank you.
No further questions on that item. And I see no further
Yeah,
questions.
that was the end of our presentation.
Ms. Miller.
Sorry,
Okay.
I was late to the button. Thanks for presenting today. You did a great job with this. I just have a question. I appreciate Mr. Davis answering some of my questions ahead of time, so I didn't extend the time here. But when you receive things from Neola, is there a way to preview for board members? Because there was a couple of items I asked Mr. Davis about, and he said if it's not been requested, or if there's not an ask for it, you may not be updating all of the policies because you get lots of them. And I know there's only one of you.
Yep.
So what is the current process for that, and how do we know without board members reading through, everything that you have to go through? Yeah.
So the process right now, when I get an update from Neola, I'll go through it and separate it by which kind of department heads it belongs to, which policies are in their area, and then send it out to them and then work with them. Obviously, if it's something that is mandated by statute, we have to add it. There's no question about that. So we're adding that. But then sometimes there's things that are optional, or there's options within the policy. So we just work with the appropriate staff to determine if that fits. So that's how you'll see sometimes they select certain options and you guys ask questions about that. And then from that, then I'll work with Chad and our legal team if necessary to review it before we give it to the superintendent to add to a work session for your review. Does that make sense? So there's never, if we're given if it's given to us by Neola, it always goes to the department staff. And then they're determining, like last year, we had one that was very specific to if we had district-issued cell phones. Well, we don't. So that policy didn't need to go any further because we didn't need to have a policy about something that we don't even have. So there may be those occasional things that it just doesn't fit with what we do, but for the most part, anything that comes from Neola is going to come before the board at some point.
Okay, thank you.
Okay, no further questions.
Thank you.
Thank you. Thank you both. Next item is instructional calendars for students, teachers, and paraeducators. Mr. Pitts and Mr. Warren will come forward. Board members, as they approach, just to give you a further update, this has been, for lack of a better word, calendarized for each year. It will occur every September, so the board will get we will have at least 2 years in advance, always posted on our website. We've gotten feedback from many of our community-based partners, especially municipalities, who rely on our calendar to help schedule summer camps and other activities, so it's important for us to make sure we get these done in a timely manner. So again, this September, or the subsequent September, we bring 2 more years too, so we'll always be, at that point, we'll probably be 3 years ahead of the curve. So, Mr. Warren.
Thank you. I first want to say thank you to the calendar committee that came together. We had a very successful and beneficial day together. The calendar committee is a group of 30 or 40 individuals that come together representing district staff, many different departments, regional assistant superintendents. We had school board representation, and we appreciate that input. We have union representation, as well as community members that join us. And lastly, we have representative principals joining us from the respective levels of elementary, middle, and high as well, providing input as we go through, I like the word of calendarized approach to our discussions of how we establish our annual calendars. I think what I would like to do, because you have an executive summary in front of you, you have 2 attachments that are color-coded with monthly sheets behind them, which I'm happy to walk through. I will say this, the draft tentative 25-26 instructional calendar and the draft tentative 26-27 instructional calendar is the working document that your calendar committee, that the superintendent directed come together, agreed upon to bring before you today. It is helpful if you wanted to reference it because you can look at the individual months and see at a glance. If I'm going to talk in a minute about split days for staff development or instructional time, you can see real quickly where the various breaks are with respect to the days of the week when those fall or otherwise. But I think in the essence of time, if you'll allow me, I'm going to summarize quickly what you'll see is I'll use it as somewhat of a template that you'll see between the 2 calendars, and I will summarize both years for us. But I'll stop after the 25-26 and see if we have any questions, and then we'll go to 26-27. The first thing for the 25-26 calendar is the fact that August 1st is our first teacher work day. That is a Friday. And the next most important day is when our kids return, and that would be August 11th is the first day back for kids. Both calendars are going to establish 6 teacher work days and 4 staff development days. That's outlined in contract. And we also worked in discussions providing for 10 early release days as well. One of the breaks that's first coming after school begins is Thanksgiving break. It is a full week. It is 5 weekdays, and it will be from November 24th to 28th. The next break that we summarize is winter break. It will be over the time period of 12 weekdays, taking us from December 22nd to January the 6th. Spring break in the following year of 26 is a full week, and that's March 16th through the 20th. And then we conclude our school year in May with the last day for students being May 28th, and then teachers ending their work contract on the 29th of May. So I'm going to pause for a moment before I go to 26-27 and see if there's any dialogue or questions with respect to school year 25-26 calendar. See, oh, okay.
Mr. Sharpless.
I want to say first, thank you, calendar committee, for number 1, starting school for the first day of students on Monday. I appreciate that. one comment I want to make too. The 26, 27 calendar, I like how we're not coming back after Memorial Day. And I'm assuming that it just couldn't be done on the 25-6, which is, but at least it was going to happen in the 26, 27, only because when I talk to teachers, they tell me very little instructions happening after Memorial Day on those few days. A lot of times it's for incentives and things like that. They'll, even talking to some administration, they do those incentive days. Not really a whole lot of learning happening during that time. Students are already in summer mode after Memorial Day. So I appreciate the calendar committee, at least on 26, 27, making that a hard stop. And then I have just a general question. And this isn't particular to 25, 26, but it's in general. Our early release days. I'm just curious, I feel like back when I was teaching and even when I was a student, we just would have days where it would be just a teacher work day in the middle of the year rather than having these 10 different early dismissal days where we're dismissing a couple days early. And I'm just wondering what's the advantage of having an early dismissal day where less instruction's happening in the classroom because time is, it's 2 hours less in the school day. From when I talk to teachers, that's what's happening versus having just a few days where students aren't coming to school, where two plus two plus two plus two, is 8, right? So my idea is why do we have the early dismissals versus just having teacher work days?
The early dismissals provide an opportunity for administration to have opportunity to access teachers as well for training. Mm-hmm. Some of the days are also split for them to have individual use of their time as well. We strategically look at those days with respect to when the grading periods are ending as well to try to build time with respect to having access in your classroom to do the activities you need to prepare for grades as well for some of the days.
Okay. And that it would be more advantageous to have, because I know if it's a parent, it's a 2 hour, it's 2 hours earlier that I have to find someone to go pick up my kids, right? And so I would just rather have less of those and maybe one full day where I have to find coverage for my kids. I'm just curious why we did that versus just having a full teacher work day less often.
Correct. Okay.
Okay.
Thank you.
Ms. Fields?
Thank you. Interesting. That's the same comment that I have. Early release, especially for high school students. By the time they get to school, it's time for them to leave and to do whatever. And looking at it from a different set of lenses with Girls Inc., I hear from the girls often that not much learning has occurred. And so my question would be the same as Mr. Sharpless, is why not look at giving teacher work days more and less of the early release? And the other question that I have, I should know this because I work it, but how many early release days do we currently have?
There's 10.
Okay. Well, and then one of the things that I've heard and from different people is on some of the early release days, this is like an early day before a holiday. And so what is the value of having that early day before the holiday? Is that allowing folks to leave early to start their holiday? I'm just saying, right. That's the perception. So I'm not a fan of early release. I understand the value of it, but as a parent, as community folks, it's very challenging. And I'll just leave it at that.
Thank you. These are all remarks I'm happy to take in.
Hang on.
And otherwise.
Ms. Wyatt?
Thank you. I just wanted to add to the early release. So one of the things that the committee faced was the early release days count as days. So when we're looking to get to 180 days, if we were to, instead of 2 early release days, do 10 early release days, do 2 or 3 full days, that's 7 additional days we would have to add somewhere on the calendar, whether it's to the end of the school year, holidays, half a Thanksgiving break, those types of things. So that is part of the conversation. It also seemed in PEA speaking, and then also from the principals, having them scattered more regularly throughout the year was much more advantageous to them, because it's not, it would be great to say every training that we need to do is always going to happen in February, but realistically, there's trainings that need to happen in January or in March. There's, PEA, I think, did a great job in the calendar committee meeting of bringing up, we see that you have this and this, can we switch them, because we know that this training is going to need to happen in this month, and we want to make sure that we can capture that. So that was a little bit of the conversation, just to shed some light on that as well.
All right, seeing no other questions, comments, or otherwise, we'll provide the same summary for calendar 26-27. And to Mr. Sharpless's remark, Memorial Day falls on a different day in that year, so it did affect our calendar in a more positive way. But in this calendar, 7/31, which is a different day, that's the end of July, is our first teacher workday for teachers to return. Our students will return August 10th. We again have the 6 teacher work days and 4 staff development days, as we had in the previous year per contract. We also have the 10 early release that we calendarized and placed by the same rationale of the discussions we just had in the 26-27 calendar. With respect to our major breaks, Thanksgiving break is a 5-weekday break. It will be November the 23rd through the 27th. Our next major break would be winter break, extending over 12 weekdays, and that would be December the 21st through January 5th of 27. The next break would be spring break, being March 15th through the 19th of 27. And then this is the beautiful part about this calendar, the last day for students being May 27th. And then the last day for teachers, the very next day, which is a Friday, May 28th. So it works out nicely in that regard. I will also say, with respect to the summary, one of the things that the superintendent commissioned us with as a committee, and one of the things we want to do as we push the final board-approved calendars out, would be to provide information along with our calendars with respect to our ESY programs that occur in June and our kindergarten readiness as well. So we'll have those posted additionally with the calendar notices. So that would conclude my summary. Should there be any more additional specific questions, I'm happy to assist.
I see no further questions, sir. Thank you. I'll address a couple of questions board members asked. Early releases are preferred over whole days. As Ms. Wyatt pointed out, we are one of the districts, actually there are still a number of districts that do an early release every single Wednesday. As you know, the board here, or our school district here, used to do it midweek, which I would argue has a far more adverse impact on our families, trying to coordinate that midweek versus the end of the week. We already have low census on Fridays immediately before a holiday with our students. I provided this data to the board previously when we changed early releases to Friday. I'll be happy to provide that again. And so based off the fact that that's a low census day and other families, I'd be lying if I didn't say yes, some families absolutely will take advantage of that day to start their holidays earlier. We only have 10 early release days. It is far more beneficial for us to offer intermittent, successive trainings and opportunities for trainings and data discussions, and provide teachers with adequate time to do their grades and get them submitted in time, than it is to dedicate full days. Full day PD, I will tell you, having worked in multiple districts that have had both early release and full day professional development, you will get pushback, just as much pushback from staff saying a full day of PD is too much. It's not preferred. They preferred it in smaller chunks and their ability to digest it, have conversations, and do some team time. So that's been, I will tell you, historically, that's been the feedback that I've received. I like our process, obviously. We've got great feedback from families. The majority of our families, when we moved it to Fridays, immediately adjacent to a holiday weekend. We also were very conscientious in trying to minimize the number of disruptions each month to the greatest extent possible. Unfortunately, there are some months, for example, like October, where you're going to see 2 early releases and a full day of PD. And it's unfortunate, but we tried to spread those across. But then you go into November and December with holidays, so you have abbreviated months. If the board had an interest and wanted me to do the analysis and look at the potential for there to be full days of PD, then respectfully, the calendar would have to change, and we'd have to revisit days like Thanksgiving break. We are not in the majority, I don't believe, as far as school districts to take off the entire week for Thanksgiving, versus most school districts that I've been accustomed to take off Wednesday, Thursday, Friday, Monday, Tuesday are instructional days. So that time has to come from someplace. And to carve out additional professional development days lengthens the contract, which means subsequently you'd have to pay for 7 additional days for every single 10-month employee and 11-month employee, which we currently don't have to do. I would argue that our academic trajectory data shows that we're doing just fine with these early release days. And I think there's something to be said for having these periodic breaks. So let's take academics out of it. Let's just talk about social emotional well-being and mental health. There is a positive aspect to this where we get these periodic breaks for our students and for our staff, and I don't think that's a bad thing. But again, I'm very much open to feedback from the board, so please let me know. Email me individually, tell me what data you'd like me to provide, and we'll be happy to do that analysis and show you that. When we provided an analysis earlier in the year during our initial negotiation meetings with PEA, I was able to show them that the amount of fully released planning time here in Polk County is commensurate to the average of 10 days across the state. So, I mean, we're very well positioned in this regard. But again, very much open to any additional feedback you want to provide. Happy to do the analysis. So please let me know. Okay, that being said, next item up is the fee template for control tower program at Travis Technical College. Board members, as Ms. Bennett makes her way up to the front here. I don't know if Laura, I don't see David. So Ms. Bennett will provide this brief summary for you all. This is in relation to the air traffic control program. And this is the next step, and I believe the final step we have in being able to position ourselves for a mid-year launch or January launch of the program to target the first cadre of students. Ms.
Yes, our
Bennett.
goal is to launch in December is the partnership's goal. So this is just the fee template we're asking your approval for that we will charge students for the air traffic control tower program that you previously approved.
Dr. Allen?
I mean, a little context on this would be great for anybody listening in. I mean, this is trending new territory for school districts within America, right? And
Sure.
so maybe give that context. And then secondly, the, Superintendent Hyde, maybe you can allude to this as well, who we're targeting in that first cadre.
Sure. So the first cadre, our understanding is they're going to be targeting recently retired military veterans. So we'll get a higher completion rate. And quite frankly, I don't know if anybody else was watching the news this morning, but this made national news this morning on the Today Show, I believe. They were talking about the shortage and all of the strategies that are being implemented across the U.S. to fill these vacancies because they are definitely aging out and retiring at a large rate. It's a high salary, wage opportunity for our students. It's very stressful, but hopefully the training and things will help mitigate that. But again, we're targeting a combination of adult learners and our high school students, but this first cadre will focus on recently retired military veterans.
Very exciting.
And we wrote we helped write the curriculum or the state frameworks that were adopted by the state to initiate the program a year or so ago. So this is a year in development to offer this program. It's in partnership with the Bartow Airport and another agency that I apologize I don't have in front.
And this program, if I recall correctly, is, I want to say it's less than 25% of the average national cost for this similar program.
Correct.
We are providing a considerable savings, and again, it's exciting for me to know that not only will we have a successful first cadre, but as we start to market to our high school students, their earning potential is going to be significant. $90,000 to over $100,000 a year is pretty amazing opportunity for our kids. So,
Thank you, Ms. Bennett.
Mr. Sharpless.
I'm really excited to hear that it's 25% less than what's out there. It certainly helps. I was just asking, do you think that this fee structure is going to be sustainable, considering we're giving a premium product
Yes.
for a reduced price?
Yes, we do feel that this will sustain the program. It will allow us to cover the costs of the facilities we will be using and the partnership we have. So yes, this is the lowest price we could come up with to sustain our needs.
Because the next closest program, if I recall correctly, is in southern Georgia, and it's
Yes.
over $50,000 for tuition for students to participate in.
Yeah.
And we are considerably cheaper and more affordable, I should say, more affordable than that. Because again, the goal is to have students be certified and be able to go out in the workforce without considerable debt load. So I think we're providing that opportunity, and I look forward to seeing how successful this is going to be. And quite frankly, I'll say it, if we end up with a larger participation of military veterans, I'm okay with that too. Because our adult ed programs are significant and will truly continue to benefit our community. So I'm excited about that, to be able to serve that segment of our population.
And this program will allow for a rolling enrollment, so they'll be able to take, and when it says 48, we won't have all 48 at one time, but throughout this school year, we would enroll over, 48 students is our goal.
There are no further questions. Thank you, Ms. Bennett.
Thank you.
Last item I have for you as part of my presentation is the CFAA East conversation. This is just my preliminary presentation to the board, under the understanding that we really can't take any official action until the October board meeting, so there's plenty of time for you again to review, ask questions. For relatively newer board members, I have provided you with a copy of the contract that we initially entered into when we built the original CFAA facility. We are very fortunate that Central Florida Aviation and that partnership group has a donor who's willing to bring funds to the table. They have asked for me to have a conversation with the board and perform our due diligence. There are multiple options available to us, similar to what we did previously, where their donor would provide the funding to build that facility on the Winter Haven Airport. They've already secured that parcel. There are options for the school board. Would we be willing to split the cost with them? Right now, the estimated cost is around $15 million, but that's before our architects and everybody else has gotten involved to ensure that we're meeting SREF standards and those types of things. The second option would be for us to potentially do exactly what we did previously, which is they could fully fund the facility, and then we would do the leaseback option, which right now is a 25-year leaseback option, and our payments actually don't necessarily go back to pay off the note. They use the money that we reimburse them each year to pay for student scholarships so they can continue their flight training. And then the third option would be we bring some funds to the table for infrastructure. Approximately $3 million would be needed to develop the infrastructure on that parcel on the Winter Haven Airport. So these are the things that we're talking about. I wanted to let you know that that's out there. I'll be bringing a more formal presentation to the board, but I wanted to make sure I provided you with the estimated costs. I provided you with the former contract, and then I will be bringing this back at the next workshop for additional conversation. I have ensured the partner that we have an interest, and that program at Winter Haven has grown exponentially. I know that some board members, I know we had initial concerns about any potential negative impact to the existing CFAA program, but there has been none. And quite frankly, what Winter Haven has been able to do is provide the services and access to the east side of the community, because the distance and travel time associated with that for our students actually became a deterrent to them being able to participate fully and complete the programs. And so I'm very excited to see that that program is doing incredibly well. They're over capacity and they have a waiting list, and that's in large part due to the amazing staff there who build relationships with kids, but also the quality of the program. What our students are doing out there is meaningful and relevant, and it's a great program for us. And so I'm excited to be able to bring this opportunity for possible expansion of an additional traditional facility, because as you know, right now, we've got them in portables out there and I don't think we expected the growth to happen the way it had, and we have to stop doing that. I think we have to assume everything is going to explode overnight, because that's exactly what happened with student enrollment and participation. But again, that's really attributable to the amazing staff and leadership on that campus for this program. They really do a great job. So, board members, I'll ask for any questions that you may have at this time. Ms. Wyatt.
I just want to say thank you for bringing this, and I am excited to see expansion out there. It is, for those of you who have not had an opportunity to visit, they like having people come visit, so feel free to stop by anytime. But they're doing some really incredible things, even just in portables, and I can't wait to see all that they're able to accomplish when they have a real building.
And I should point out, they do utilize the hangars. They're not trying to build aircraft engines and do those things in portables. They're doing those in the hangars and in those facilities. But again, it's a program that's really grown exponentially and serves the Northeast as well very adequately. So it's an exciting time for our kids in our community. Ms. Fields.
Thank you, Superintendent Hyde. And I would imagine when you bring us more information, you'll be also showing us where the monies would be coming from as it relates to that.
Yes, ma'am. Some of this, well, yes, ma'am, I'll bring you a formal presentation. I'd rather not speak off the cuff.
Thank you.
You're welcome. I see no further questions or comments. Mr. Pitts.
Thank you, Mr. Hyde. I'm still able to say good morning.
Good morning.
Good morning.
A few minutes
To
left.
Mr.
4 minutes.
Hyde and the board members and to Mr. Murphy. Yay! Okay. I'm looking for,
Turning the air down for you, Jason.
the slide. Do we see a slide? Mr. Hyde, do you control, you got it? Oh, I'm sorry. Thank you. My mind is working slow today. All right. Good morning, board members. I had handed out this presentation to you earlier in case you wanted to write notes on it. Here to give an update on the new high school in the Northeast Polk area, also known as Point Siena. This is an invitation to negotiate process, also referred to as an ITN. Just a reminder that we are still under a cone of silence until the district announces an official action in respect to this solicitation. I'm going to give you kind of a quick summary of events that most of you are very aware of, but just as a reminder, PCPS received an unsolicited proposal under the provisions of Section 255.065 of Florida statutes for a public-private partnership, also called a P3, in early fiscal year 2023-24 from building tomorrow's schools. This P3 process proposal was to design and construct a high school facility in the northeast area of Polk County with provided land near the intersection of Lake Hatchendahaw and Marigold Avenue in the Point Siena area of Polk County. Now, under a P3, there's a couple components that have to take place. And for this to qualify as a P3, it was the provided land that makes it a P3. As you know, the district did not have in its inventory the land, and that P3 proposal is what made it a P3, was that provided land. District staff reviewed and evaluated the proposal, and with the direction of the superintendent, the recommendation was to move forward with the invitation to negotiate process. This process is authorized by PCPS Policy 6320. This is a competitive process that to determine the best method to achieve a specific goal or solving a particular problem, and to identify one or more vendors with whom to negotiate to receive the best value for our district. In April 2024, PCPS advertised the notice of the ITN in the Florida Administrative Register, also referred to as FAR, the Lakeland Ledger, and the PCPS website, which is what we needed to do for this process. In May 2024, the invitation to negotiate number 2024-001, also the district's very first ITN, was posted on the vendor link platform. Under this invitation to negotiate, the premise was to construct a new high school campus. These are the specifications that were called for. I'm going to go through these specifications. Construction of a new high school campus provide a site location of the campus that includes a minimum of 60 developable acres within the requirements of the area that was included in a map on attachment C of that ITN. That's what the map looks like in the section of Northeast Polk. Specifications also called for approximate square footage of 350,000 square feet, built to the PCPS ed specifications and building specifications. Proposals were asked to include safety and security features, including fencing, camera, lighting, and a single point of entry. Standard high school sport amenities, including football track stadium with lighting, a baseball field with lighting, a softball field with lighting, a gymnasium, additional athletic fields inclusive of field houses and concession stands, and other outdoor areas. These athletic facilities should comply with the Florida High School Athletic Association and the National Federation of State High School Association requirements. All work should be completed by the commencement of the 2027-2028 school year, must be inclusive of all on-site and off-site improvements. The school plan should include traffic pattern management for staff, parents, and bus transportation, separate parent and bus loops with aluminum-covered canopies, parking spaces for staff and visitors. The design of the school must support the district's new one-to-one initiative, whereby each student is using a computer device such as a tablet or laptop. All furniture, fixtures, and equipment, also known as FF&E, must be included. And the project shall be built according to state requirements for educational facilities requirements, also known as SREF, and Florida building codes. So we issued that ITN, a request for responses. In June 2024, 2 respondents submitted proposals: Building Tomorrow Schools and Fortress Secured LLC. At that time, we had, in the invitation to negotiate, said that there would be two initial phases. Phase 1 was to take all those respondents and then move forward to evaluate and then move forward into phase 2, which would be a short list. So we had these 2 submitted proposals from these 2 organizations, and their proposals met all those qualifications, those specifications that I just went through. Let me pause there for a second. I went through that very quickly. Are there any questions about what I just went over before I move forward? No? Okay, great. So we had these 2 solicitations that met those specifications, and in August, August 15th, 2024, each respondent was given 1.5 hours to give an in-person presentation of proposals to a 10-person evaluation committee, which included an alternate. And I had submitted those names to you in a previous email who was on that evaluation committee. On August 27th, 2024, each respondent was given 1.5 hours to give an in-person response to 34 questions that was scored by the 9 scoring members of the evaluation committee. Each evaluation committee member scored the questions on a scale from 1 to 5, with 1 being the lowest score and 5 being the highest score. If you take 5 points times 9 committee members times 34 questions, that equals 1,530 possible points that were available on this scoring method. The results were Fortress Secured received 1,393 points. Building Tomorrow Schools received 1,118 points. It was a 9-0 committee vote. So that brings us up to where we are today. So per the allowances listed in invitation to negotiate number 2024-001, we can move forward with one vendor, both vendors, or neither vendor. Now, that moves us to the recommendation and the timeline. I'm looking to Mr. Hyde to see if he wants to take control of this slide, or you are fine with me moving ahead.
Go ahead.
Okay, all right. So again, both respondents have met the specifications outlined in ITN number 2024-001. Pursuant to section 4.3, paragraph 4 of this ITN, PCPS's negotiation team may negotiate with multiple respondents to achieve the contract that provides the best value to the district. After discussions with the superintendent, the recommendation is to enter contract negotiations with both respondents to determine their best and final offer, also known as a BAFO, during the month of October. The hopes would be by October 31st, the negotiation committee recommends an intent to award based on that best and final offer. There will be discussions with the superintendent, and if we meet that timeline, then we would hope to bring to the November 19th board meeting an interim agreement approval. Now, we really need a comprehensive agreement, but an interim agreement gives us the opportunity to start doing some due diligence and start kind of moving forward as we develop a comprehensive agreement. Not sure if we can meet that December 10th, but we hope to have then the comprehensive agreement approval to the board as the last board meeting of the calendar year. Again, I just want to say that these dates are estimated and subject to change. Notification of changes of the time schedule will be made to the registered proposers under specifications of this ITN. PCPS is not obligated to make an award. That was a quick presentation. And
Ms. Cunningham.
Thank you, sir. Maybe it's just me. I have no idea who Fortress Secured LLC is. Never heard of them, never heard, where did they come from? How did they all of a sudden get in the mix? I thought we were working with Building Tomorrow's Schools to try to move forward with this. What happened? Who is this other company and how did they come?
Fortress Secured is comprised of an organization called Nest Construction. Rada Construction is also a part of this Fortress Secured. Nest Construction is really the management part of that organization. Rada Construction would be the construction company, and Shingles Schultz, who would be the architect. They were also the architect of Davenport High School.
So the last I had heard, and maybe others have heard differently, last I had heard we were discussing this proposal with Building Tomorrow's Schools. We were moving forward, and the difference was that we requested at that time, again, I'm not in the timeline here, I'm just from memory, that the one key that we wanted was the cost of the inclusion of a piece of property, not just here, we can build it, you got to go find it. So, and I thought they met that specification, and then after that, we were going through Superintendent Hyde, I thought, and you were having our attorneys, and there was a gentleman's name, I don't remember, that you said had to go through and make sure that these contracts would be valid. So that's where I thought we were progressing. Today is kind of blowing my mind that now we have a second party. I've never heard of them. Maybe the rest of the board has, perhaps. But I don't know how they got stuck in the middle of this when I thought we were almost to the end, provided the attorney who had done these types of build-outs before, okayed everything. Maybe the attorney came back and said it wasn't okay. I don't know, maybe I missed that. You know, I mean, I've missed a meeting here and there, so help me out here.
Yes, ma'am. So starting in August, I began messaging with the board. We had retained counsel
Yes.
who has a specialty in this.
Yes.
And at that time, he recommended the ITN process, which allows us to advertise it for 90 days. Multiple companies initially submitted inquiries. I've provided a list of those to you previously. At the end of the day, only 2 met the requirements. And then both of them were provided an opportunity to come in, formalize their submissions, and then that's where we are today. But in fairness to both parties,
Yeah.
I have asked staff to make sure we move forward with both parties, even though one scored better than another. I wanted to make sure that we reviewed everything in its entirety, and the ITN that was initially posted specifically stated that we would provide an opportunity for a BAFO, a best and final offer. So in order to be fair to both parties, that's the step that we're at now. Again, in partnership with our external counsel, who's guiding us in this process, that was also his recommendation, was move forward with the best and final, and then the board will be able to address that. As Mr. Pitts shared, actually there were, I believe, 5 or 6 criteria that we stipulated had to be met with the new high school, including proximity to existing utilities, including the location of the school had to be within a specified mile range, because otherwise, you know, securing land someplace else might be easier, but it may not suit our needs because we may not have enough population density to justify a school.
Or infrastructure.
So, yes, ma'am. So that's where we're at. I would love to say it could move faster, but we're doing this on advice of counsel, and that way we all stay above board.
Thank you, sir.
Yes, ma'am. Mr. Sharpless.
Yeah, so we had our last work session, and during our last work session, we were talking about the 34 questions that the individuals, the two organizations had to answer, and we were told in our last work session that we were going to get a copy of those. I never received anything. I even emailed about it, and I never received what they're being scored on, right? Because I would like to know. You know, 'cause I have certainly priorities that I would want to make sure are reflected in how it was scored. And I've never received those. And so I'm a little concerned with that. You know, I feel like as a board member, I have a fiduciary responsibility. I mean, our whole board does. And so the cost is a big part to me. And I don't even know what's all being included in that.
So I'm going to interject here for a moment, if I may, and Mr. Murphy may need to jump in here as well. I am more than happy to go back and review the meeting minutes to determine whether or not that request was made. If that request was made, then I failed to provide that to you because that does not come from staff, it comes from me. I do have the questions, but I want to be really careful here. The board may not influence those questions. The board has the ultimate responsibility. When we first brought this proposal to you, and I outlined all the requirements that we were going to stipulate for anyone who applied for this, that was the opportunity for board input. The questions that are submitted to each party is left to staff. So I'm just going to urge some caution here about a board member trying to say, well, I want those questions to reflect my interests, because that's just not how the process works. We have a necessity to address specific questions for specific reasons to ensure that the project, whoever's going to build the project, can satisfy that need. But again, the board had input at the beginning of the process. The board ultimately gets to make the decision based off my recommendation. So, Mr. Murphy, if I'm speaking out of turn, please. But I just want to urge some caution that I understand we'll provide you those questions if that was a request. Happy to do so. Regardless of it being in the minutes, you've requested it here, so I'll follow up with that immediately because I have those questions and the score sheets in my office. So
that was my major concern. I mean, it was brought up, and I would like to receive what I was told I was going to get. So.
Okay.
One of my concerns or just issues that I want to make sure we're mindful of is to the extent there is still a cone of silence and to the extent that there is still some confidentiality that relates to these proceedings, if board members receive this information, be treated accordingly. And I agree with the superintendent and his statements. that he made as it relates to this process.
Ms. Fields?
Thank you. I've been on the board for a minute, and I don't think we've ever used this process before. So it's something new for all of us. And typically, whoever scores the highest, they get the award. So I think that it's good that we are doing our due diligence and hearing from both of the companies. And I think we need to let the process work. And as Mr. Murphy said, we need to make sure that we're mindful that this is very sensitive information, and we need to utilize it and chew on it for ourselves.
Mr. Murphy, you still have something, or I know you jumped in, okay.
No, sir.
Ms. Wyatt?
Thank you. Mr. Murphy, I know Mr. Bridges went over this well at the beginning, but can you go over again what the cone of silence is, how long that takes place, and what our responsibilities are during that?
Thank you. The statute would outline the cone of silence, and I don't want to parrot I don't know what Mr. Bridges told you because I wasn't here, but I would suggest that Mr. Bridges was likely correct in his articulation of those parameters. If you'll give me an opportunity to review what those parameters were, I don't want to say anything off the cuff or give you advice or counsel that is not consistent.
Thank you. It was just so long ago that having some bullet points of this is how long it is, this is what we can and cannot say would be very helpful, I think.
Okay.
Thank you.
Dr. Allen?
Thank you, Superintendent. I was just curious, we're referencing the outside counsel, Mr. Pitts. Could you maybe give context of what that looks like from your perspective and how many touch points we've had with outside counsel? And in the timeline in particular, I think I was looking, this was in Superintendent's update. It was enclosed maybe 2.5 weeks ago, and the update that he sent to us on Friday was the Phase 2 questions, right? So that's what I'm referencing in that particular part of this process. What would that look like so we can understand?
So let me start with question number one. When the P3 proposal was accepted, that organization submitted $25,000 to cover cost of counsel and for review by an architecture firm and that sort of thing. So the current attorney that we acquired or went into contract with was back in the early spring. As this invitation to negotiate was a new process, he's helped guide us through what we needed to meet as far as that process to make sure that we're following statute with bidding and, how that purchasing bidding process, I'll call it bidding, but the purchasing process. And we have had contact with him quite often over the last 6 to 8 months. Did that answer your first question?
First question, yes.
Okay.
And I mean, at what point will we be privy to that type of information? I'm just curious.
The information as far as our conversations with the outside attorney, I don't know that there's any, I don't want to speak off the cuff and say, those are confidential conversations, and I don't know honestly, I'm going to be ignorant here about how those are released.
Yeah, I just as a matter of information, my general understanding would be that Mr. Pitts is correct. Those would be likely confidential. Essentially, who holds that privilege? That could be the subject of further discussion. My sense is I don't even know who it is, but nonetheless, that's all right. What I glean from this is that we've obtained counsel to advise us on the proper procedures to follow in going down this procurement process that's new to us. And that we wanted to make sure that we crossed our Ts and dotted our Is as it relates to this particular product that we are ultimately going to be either owning or leasing. And it's very important because we're dealing with significant dollars, obviously, and significant potential liabilities. So in order to have the opportunity for our professional staff, the superintendent's professional staff, to go down the proper road and do the proper things, my assumption is that is the sum and substance of the discussions and the ultimate advice that would have been rendered during those discussions. So whether, I mean, I think I'm accurate in how I'm characterizing them. I'm not privy to them, but my general sense would be that the product that you are seeing, this template or this presentation that Mr. Pitts is making today, along with the superintendent's remarks, would have distilled down that advice, that counsel, and so there really isn't anything beyond that that would be helpful, likely, to provide. I mean, it's just, this is coming to you with recommendation of the superintendent based on legal counsel's advice that apparently has some expertise in this particular type of procurement delivery method.
And the firm that we have engaged with and hired and put on a contract is CSK, and the gentleman's name is Brian Williams with that organization. That's not confidential, but
Right.
I just didn't want to, didn't want to release any information of conversations that we've had that might be confidential, and I'm not saying that they are, but like.
Okay. And just as long as there's a point of record, I mean, that would be much appreciated, especially if we're trying to make a decision on that. And I think that would then allude to that next question, right? So when I look at the Phase 2 questions, I'm more so looking at the rubric, right? And my question on that is, how was that rubric determined? And, you know, yes, because, you know, as Ms. Field says, this is part of the process that we've always known. So, you know, and I'm just going to come out and just think of it from a professor's perspective. And so when I'm looking at a rubric, typically I'm weighting particular categories, right? So when I look at the rubric itself, the category, for example, around time and budget, okay? Everything's equalized. All these, there's 5 categories. They're equalized as far as their percentage. So if I would liken it to my role as a professor, I'm going to give the same amount of points for a title page on a paper or essay submission as I would as the analysis, right? So my question then is, you know, how is the rubric determined? Because all these are equal in weight, whereas, you know, yes, we don't have a say in this, but time and budget to me would probably be at top, right? Whereas, you know, building specs maybe would not be as prevalent to me as that one, but I don't know if you can speak to that.
So I can speak to that because I was most influential, I will say, in the way that rubric was designed. Originally, there was going to be some weighting, but when we decided to do a scale from 1 to 5, that weighting kind of went away. We did have in the initial Phase 1 weighting on the different categories that you just talked about when we were going to narrow down however many respondents we had. We only had 2, so they moved forward in the process. So there was no weighting on that rubric. You see 20%, 20%, 20%, 20% in what you're looking at, but the weighting was really on just the answers to the questions. So there was not a weighting on those factors that you just included.
So then the second, I guess maybe a follow-up on that, right? Location, 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 right? This has been communicated at the board level over and over again. Was that, when that was defined, how was it defined for the committee to determine, right? So if I'm looking at that one, location, what's the, you know, we're looking at a parameter of 10 miles within this point. And So I don't know if that was addressed. So then with a committee member looking at that, they have an absolute, in a sense, to be able to define that in a rubric scale.
Correct. Now, both groups met the initial qualification of a site that was in the boundaries that we were looking for. So each site, during their presentation, they gave information about, how high the site was and how dry it was. The locations, one's more east and one is more west. We looked at how it would affect traffic patterns, student, locations to student, and that's where the one organization scored higher than the other organization.
But may I?
But let me just say something. Both sites are good sites.
Let me interject something here, if you don't mind. I think that in the context of how this is being presented to the board, this is information, and I don't know that we really want to go down the path too far on this today. I think what I'm understanding is that there are two ultimate entities that have made it through this ITN process, and that the superintendent and his staff, as authorized by the board and Florida statute and whatever applicable policies may be available, are going to get a best and final offer under whatever scenario from both qualified entities. And I think that's the gist of the information that I believe is trying to be conveyed here today. I think all of the stuff that has occurred already has occurred. And what will be presented to you, or what will be recommended to you at the time period set forth in the presentation, will be as a result of that. So I don't think it's a good idea to probably go down the path today, but I think that if I'm mistaken in this, the superintendent will correct me, but my general understanding is the superintendent's presenting this information to the board as information. Ultimately, there will be a best and final offer that will be then presented to the board on the superintendent's recommendation, and that can be voted. And if it's approved, then it's approved, and if it's not, then you go back to another, there's nothing, we have not crossed the Rubicon yet, as far as my general understanding would be. And I'm just a little uneasy about getting too far into the weeds on things at this juncture. Not that it's not appropriate for the board to have full information, or in the interest of transparency, but I think that's probably the gist of this presentation. I'll defer to the superintendent if I'm either understating or overstating that.
No, that's correct. That's accurate. Thank you. Ms. Cunningham?
Thank you. I respect your opinion, Mr. Murphy, and thank you for your comments. However, Dr. Allen is bringing up very valid points. At some point, I do believe that we need to discuss the questions that he has been asking, because it does make a difference. How did you define location? Why did one get a better point, or what? I don't even know what the points are, okay? I have no clue. I haven't seen anything. We've already stated that. But how was that defined? Did everybody in the room know that it meant from a point you had to be this much, or what we don't know is making us skeptical of the system because we don't know it and don't understand it. And I think with a decision this large, with the financial impact to our community, I think we need to know. If today's not the day, I agree. Maybe it's not. You're basically giving us an update. But I think at some point in a work session, maybe not at the end of the day like today, but we schedule it first up at 9 o'clock, and let's talk about how this was done. I'm assuming this is open and in the sunshine. We're here talking about it. I understand there's a cone of silence, and I get that there's certain things we can't discuss amongst each other, but I think openly in a forum like this, I think we need to have more of the information. I'm uncomfortable with the way it's gone, and when Dr. Allen asked his question, I was like, okay, right. Why did George get more than Harry? I don't know. How was it put in there? I just think we should understand how we got to this, because as Ms. Field said, this is new. We've never been through this ITN situation, and I just want to make sure we make the very best decision ultimately for our kids and financially for our district. So I don't know how we become more apprised of the process other than just a cursory, here we go, these are the events, and now we're here, we're down to 2, now we're going to go on to this, and I don't want to misrepresent the name of it, but the next step to get the best, BAFO. I don't know what that means, but you've explained it, so I don't know. Is there an opportunity for us to meet and talk a little bit more about it? And if you tell me we can't because it's confidential, I'll be quiet. But I really feel like some of Dr. Allen's questions were very poignant. I have them. I know Justin did. That's why he asked it. He just didn't ask it the same way as Dr. Allen did. So I think we're all wanting to understand it a little bit better, that's all. So any light that can be shed on this, since we're going through it for the first time, and then we'll know obviously better next time going forward. But I thank you, Mr. Murphy, for your advice, and I respect it. And I agree, it's not something probably to discuss today, but I think it needs to come to the forefront and be discussed at some point, even if it's with superintendent and somebody needs to be in the loop of how this is all going down.
So let me say something that maybe will make everyone feel more comfortable.
Thank you, sir.
Okay. The scoring committee, the questions that were asked were to flush out information to better understand both proposals. Okay. So we're at the point now where we can still move forward with both vendors, okay, and understand in more detail what those proposals are. The superintendent will then bring forth a recommendation to the board. All this information will be included at that time. At that work session, all this information will be released. We're just still in the process of getting to that point. Okay, so I don't want to put too much credence in the questions and the scoring, because that was just to flush out information for the evaluation committee to give information to the superintendent on how we're going to move forward with this. If that hopefully that made you feel better.
And it does. The only part that doesn't match with what you're telling me is the fact that you already rated them. You already gave them ratings. Had you not given them ratings and you said, okay, we got 2 guys, here's the 2, now we're going to the next step, you've already put ratings in there. And to me, that's like, okay, we've got a preferred vendor. That's how I read that. Just FYI for the next time. I don't think I would put that down there. I would say we got our information and now we're moving to the next step. Thank you.
Ms. Fields?
Okay, so my thoughts are similar to what Mr. Jason just referenced. When we have ever had anyone to bid on a project, you're right, we do get the rating sheets. We do see that. And what I'm hearing from Mr. Pitts is that we will get that when the next step comes, because we do need to see that. But I don't think today is the day to do that. I think that it needs to be the next process. And I am sure that Superintendent Hyde will make sure that all the information that's been requested today will be afforded to the board. Correct me if I'm right, or correct me if I'm wrong, Superintendent.
Actually, I will ask the board to submit their questions in writing. That is the typical process that occurs in a workshop before a vote. There's typically 2 weeks between a workshop and a voting meeting, and the board utilizes that time for follow-up questions or discussion. So I've captured a few of your questions here today, but respectfully, I think each of you needs to submit them in writing. We have used this similar process for other projects. I'll leave it at that, but if the board has questions they'd like me to address at the next workshop, happy to do so. But I don't know that I'm going to be able to give you some of the specific questions. Why did one group get a better score than the other? I don't know that I'm going to be able to give that to you, because it's dependent upon each of the individual scores and the averages of their scores. So each one of them may have a very different opinion as to why they gave a score they gave. But we'll see what we can do. Ms. Fields, was that it?
Sorta, kinda.
Sorry, I didn't want to move on without giving you the opportunity.
Sorta, kinda. And I'll just, since this is hot, I'll just use it. It is now going on 1 o'clock. And I know we had a full agenda, and I know that we had said we were here from 9 to 12. Well, that didn't happen. And I know that we have the general counsel re-advertising discussion that's hot. But unfortunately, I didn't plan to be here all day. So I just want to make sure you all know, if I have to leave, I'm going to stay as long as I can, but if I have to leave, I will. But I think that the next topic is very important, and I want to get a better understanding as to where we're going as it relates to this. So thank you for letting me use the hot mic.
Dr. Allen?
Yeah, I was just going to say, I mean, we're a good process. We're moving through a good process. I know that, you know, you had mentioned on record as well the fact that we're going to build policies on this and so forth, because this is new territory. With that, I just hope that we get to work through that with this general counsel as well. Thank you.
There are no further questions, Mr. Pitts. Thank you very much, sir.
Thank you.
That concludes our portion of the superintendent's report. Board members, for your information, the donation report is included. I'll turn it over to you, Mr. Chair.
Ms. Cunningham.
Yes. Just a quickie for Superintendent Hyde's benefit. Back in the calendar section of our discussion today, I think I sent you a text on page 13. It notes that we have 2 weeks for spring break in 2027. So I was wondering if that was correct or if that's a typo.
It's our bicentennial year, so we're going to take, no.
Is that what we're going to do?
No, ma'am.
I was all excited as I was putting it on my calendar. So
I replied to you and I
Oh,
sent,
you did? Sorry.
I've
Okay.
already sent it to Mr. Warren, who's giving me the high sign. It's already been corrected.
Okay. All right. Just want to make sure, because if not, that's a great 2 weeks for everybody.
Yes, ma'am. No, ma'am.
Amen.
All right, board members, we are now moving down to, this is new business. This was not brought forward from the superintendent. So whoever asked for this item to be noted on the agenda, it would be now your time to speak. All right, Ms. Wyatt, you're recognized.
Hello. I have asked for this in the past. I'm not sure if that's why it ended up on the agenda or if it's if it was just from past conversations. But I know every year, typically the meeting right before or the morning of our reorganization meeting, we talk a little bit about our process and how we do it. And every year we discuss that it's maybe not the best process, because essentially whoever's hand is seen first or whoever hits the button first that's the only person that's able to be voted on, unless you fail someone to be able to vote on your favorite candidate. So looking at revamping that, I know Superintendent Hyde last year when we brought it up had brought a couple thoughts that he had from previous districts, how it had happened. I know City of Winter Haven has a great process where essentially everyone is nominated similar to how we do, but instead of going through and doing a roll call vote, everybody writes down who their top pick is, and then it goes from there. As far as, if there's not 4 people vote for one person, then they take the top 2 contenders to find the best person for chair. The way that we currently do it, oftentimes if you sit on this side of the dais, your vote may or may not really count, because if it's a roll call vote and Lisa Miller pretty much gets to vote for whoever's going to be chair and say aye. So just looking at what our process is, and if we have an opportunity to revamp the process.
Is that process codified in a policy that we have?
No.
I'm sorry, I don't have that answer as I sit here as general counsel. I probably, if there is a policy, we should follow it. If there is not a policy, and it's a practice, then
It's a practice.
Then, board I'm not, I don't know that I can offer anything constructive other than whatever occurs would need to be done at the board at an open meeting. To the extent that you would follow a process that Board Member Wyatt referenced in Winter Haven, I can speak to that. And that is a paper ballot. And the paper ballots are distributed to each elected member, and they must sign them and date them. And then they are included as part of the permanent record. So there's no secret votes. But, you know, that every year we come ready for that. And some years we don't have to use it, and some years they do. Just depends on how that works.
Thank you, Mr. Murphy. And I was going to say, we do have a policy in place, which is 0151, which just does follow in accordance to state statute, but it does not address any type of procedural act of that. Ms. Miller, you're recognized.
I'm going back now, right? It's been a while, but I think, and it might have been under our last superintendent, I thought we had changed it once at Jim Miles. Because I remember at that time, oh, well, it makes more sense that, I think Mr. Wilson and I, because we were 6 and 7, I think we changed it once. Maybe I have to go back and watch the videos, I don't know. But I can tell you, there's questions of how we've done this for a long time, for 2 reasons. One, it can be perceived that Sunshine isn't as sunny as it should be, with the process of the fastest hand going up and who can see it and where they're sitting. Also, I was a new board member, and I can tell you walking on the dais and then, having to figure that out and verbally support one of my colleagues or another isn't something that I thought was the most professional way to do things. It's been a way, it's not that it wasn't professional, it was just more antiquated than I had seen at the county or at the cities or at any other board I'd sat on, and I can't find another school board group that does the whole raise your hand as quick as you can for whoever's looking. So we've had this conversation. I'm not opposed to other processes. I'm glad we're finally having it again. Thank you.
Thank you, Ms. Miller. Ms. Cunningham, you're recognized.
Thank you, Chair Allen. Having served as chair of this district for three times in my 20 years, it's not raise your hand as fast as you can. That is so disrespectful, in my opinion. Let me please finish. The way I would describe it is when the superintendent asks who would like to nominate, any one of us 7 can nominate. It doesn't matter what order it's in. It makes absolutely no difference. If you want to run for chair, Lisa, you can put your hand up and put your name in the pot, as well as myself. So there is no, it doesn't matter the order, you take it doesn't.
How do you select the person who raises their hand?
Stand by. Ms. Cunningham, are you finished?
I'm not.
Okay.
Thank you, sir. Appreciate your respect. So I think the process that we've used is fine. The fact that certain people have not been elected as chair has nothing to do with the process. Let me just say that publicly. It all has to do with your colleagues voting or not voting for an individual who wants to be chair. It's always been done like this. I don't see any partiality. You can vote, each person votes their conscience for vice chair and for chair. It's not like who's first and then that person gets in. That hasn't been the case last several elections, if you'll go back and check the videos. So, we do the best we can. If you want to change it, I would like to see it in another district or where, because this has worked for us for years and years, and I don't feel like there's any discrimination against any individual who wants to be chairman. That does conclude my comments. Chair Allen, thank you, sir.
Thank you, Ms. Cunningham. Ms. Wyatt, you're recognized.
Thank you. So it does matter who is first because we do a roll call vote on the people in order they were received. So if you first nominated Lori Cunningham, I want to run for chair, we would all go through and vote yay or nay on you before we could even move to the second person. So if you and Dr. Allen were both nominated, Dr. Allen's who I was thinking I wanted to vote for, but I don't want to vote against you, I would have to vote no on you to even be able to get to Dr. Allen. Does that make sense? So it essentially, that is where I think we struggle, because it may be that the first person that was nominated, I'd be okay with. The second person that was nominated, that's my guy. But if the second person doesn't pass, then the third person that was nominated is absolutely not who I would want it to be. So you're essentially playing roulette with who the top contender is, that it just is not a fair process, and it's not done anywhere else in the state this way. That I have been able to find, at least, in talking to my colleagues.
Thank you, Ms. Wyatt. Ms. Miller, you're recognized.
Thank you, Chair. I wouldn't want anybody to assume because a process is obviously not best practice that it's because somebody has an agenda. I assure you that that's not the case. I can assure you that I've gotten phone calls for people who are wanting me to support chairs, third party, and I think that is unprofessional. I think that the raise the hand isn't because of where the superintendent sits. And last time, I wasn't here last time. I wasn't even in attendance, so I don't know. But the time before that, he said, I've placed some staff in the audience so I can tell who was the first to raise their hand. So it's on record that it is the first person to raise their hand. And then we count down 1 to 7. We could flip it and count down 7 to 1. But I think that using a consistent method that's used in other school districts should be something we look at and have extended conversations about. And it's unfortunate that people think there's a hidden agenda with it. Thank you.
Thank you, Ms. Miller. Ms. Fields, you're recognized.
Okay, so sometimes I sense that the process has already been done before we even vote. Okay, but it is what it is. My recommendation is to find out what other school districts do, bring that back for the next work session, and then we can have discussion and determine whether or not that works for us, if we want to leave it as it is now. That's my suggestion, so we can move on.
Thank you, Ms. Fields. All right, I see no other comments. Again, I think Mr. Murphy, we had talked about this before. This is policy 0151. If this is something that would need to be moved through the rulemaking process, that would be in consideration. I would say if we looked at Neola's suggestions around this policy across the state, you'll see a lot of variety. Obviously, we continue to do our own research on this as well. But if that's something that the board is sensing as a consensus to change or to modify, I think it would be appropriate to go through the rulemaking process. But that would be my opinion on that. Ms. White, you're recognized.
Thank you. And thank you, Ms. Fields, for moving us forward, because I know it's already been a long day. I think that it would be very helpful maybe to see from FSBA what, if they can pull for us, what districts across the state do. Is that something that you would like me to assist with gathering before the next meeting? Because this essentially is something that's going to need to be, if we're going to change it, needs to be decided in the next 2 meetings.
Sure. If that's, the will of the board, that's your point of information. I would say there's a link on their website for reorganization, and it's basically references 2 of the state statutes that deal with this. So from a research standpoint, that would be something we can consider. But it also does have a PDF for recommendations, so what should transpire on the reorg meeting. But beyond that, that's all the information they've provided on their website. And there's actually some really good recommendations in that reorg PDF that could be beneficial to us in general that I thought was of a value when I looked at it this week.
Who's our liaison? FSBA.
Yeah, so an appropriate liaison, we do have advocacy, which would be Ms. Fields. And then we serve in different, board of directors. I'll be with board of directors next week. I could reference that as well.
Perhaps y'all should look into that and
Yeah.
bring it back to the group.
Can we get that information before the meeting,
Before what meeting?
before our next work session? Like, can we have it in writing before our next work session, what other districts are doing?
Okay, I'll just attach it to, this would be listed as old business, and I'll put those documents with that. All right, thank you, Ms. Wyatt. Mr. Sharpless, you're recognized.
The only point I want to make at this is when we add items to the agenda like this, it says board reorganization. I had no idea what was going to be discussed about our board reorganization, so I had no idea what to do research on prior. So if we could please have some more information, I could certainly do a little research ahead of time. I just board reorganization can mean a lot of things. So
I apologize. I didn't realize it was put on the agenda.
Okay. All right, thank you.
All right. So, Ms. Fields, thanks for your patience. I'm sure you're here for this conversation that we're about to move through. So we're going to move now down to the general counsel discussion. So just give a little update. The job posting that we currently have, which is in the second phase, will close on September 27th. So at this point, we could be receiving a few more applicants at this point. The documents were compiled by Ms. Yvette and then provided to you. It's in front of you at this point. And I would say I did get an email earlier today from Mr. Warren that noted we had 6 applicants thus far. So there would be probably, I think, at least one more beyond what you have in front of you. So out of the 6, we're looking at 5 that have met the min-quals. And beyond that, secondly, you as a board discussed as well, if our second round of posting needed a bit more synergy, you've expressed some interest in a consultant to help us broaden that search. So this is sort of where we're at in the timeline. Mr. Warren followed up with your request, by the way, as well. A proposal from Strategic Government Resources was sent to all board members on September 19th. It noted a nominal fee and then a 12-week timeline. Okay, so that gives you context at this point. So what is the will of the board at this point? Mr. Sharpless, you're recognized.
That was from last time.
All right, thank you. Ms. Fields, you're recognized.
Okay, so I read the information from Mr. Warren, and maybe I overlooked it, but if you can refresh my memory that was not ever refreshed, if you can tell me what the cost is for Mr. Thomas's firm.
Thank you, Ms. Fields. The contract puts that at about $28,000.
$28,000?
Mm-hmm.
Wow. And so my question would be, now I know I was the one that gave the name, because I think that Mr. Thomas does a great job. However, that's, to me, a little bit high, and maybe it's not. Maybe I'm just looking at money today, and everything is high. But did we look at another firm to see if their price is comparable to someone else, or did we just look at that single firm?
Mr. Warren will come to the mic.
Thank you, Superintendent.
Yes, sir.
Focused in on the SGR because of the local focus, with specificity having history from Lakeland and knowing the communities or otherwise. Additionally, as I visited with them on the phone to request the proposal that you have before you, they have recently been in Florida hiring with several different other entities with respect to city council, attorneys or otherwise. They do have access to folks that are still in their cadre that are applying. And then to the specificity of your question, did we look at others? We looked at others in the community, but the community is going to have to go broader. You're going to bring them in from Tampa or outside the specific area of Polk County that this particular entity had Lakeland. That's why we focused there and not. If you'd like us to go back and look at other municipalities and cities where those companies are housed, we'd be happy to do that. But there are several others in Florida, but they wouldn't have the local historical piece that we discussed at our meeting.
Mm-hmm. Ms. Fields, you're still
Yes,
recognized.
I'm still hot. Thank you.
Mm-hmm.
And thank you, Mr. Warren. Superintendent Hyde, the monies that we would have to have for that, is that, I'm sure it's available. And I don't know that you can give me an answer. I don't know if Mr. Murphy can give me an answer, or anybody can give me an answer. But it's been a long time since we've actually gone outside of FSBA to do anything relating to recruitment. And FSBA is a lot less, if my memory is correct, than what we're looking at. and it's a higher level position that we've utilized them for the superintendent of schools. And so is this reasonable? Is this in the ballpark? Does anybody know if it's in the ballpark, or is that a question that nobody can answer?
I can't provide an answer to that, Ms. Fields, because I've not found myself in a position where I've hired counsel until this. My previous district, we had already secured counsel. Here, I walked in and Mr. Bridges was already counsel, so, pardon me?
What about Chad, Mr. Davis?
Meaning, we didn't do a search firm for Mr. Davis.
That's what I'm asking.
Yes, ma'am. Yes, ma'am. No, we just did a general advertisement. But for this position, here's the steps as I understand it, if I may. You advertised the position, you did not get the number of candidates that you had hoped to get in order to make an informed decision. We then re-advertised. The suggestion was made, do we need to potentially engage the services of a search firm? Some names were provided. We did our research, did our due diligence, or Mr. Warren, I should say, did his due diligence, and found that the group that currently is being recommended to the board not only has experience with recruitment, but has specific experience with securing and recruiting and retaining legal chief counsel for large municipalities and others. So that's where the recommendation came from. If the board would like us to engage FSBA to determine to what extent they do that, I'm not aware of that. I know they help with searches for roles like my own. I'm not sure to what extent they do legal. We'd be happy to ask them. We'd be happy to go back to the firm and ask them to sharpen their pencil and see if there's another quote they can provide. The goal here is to help us, when we state that, help us find the appropriate general counsel moving forward. And I do believe that in order to do so, we probably need some assistance with advertisement and who can make those personal calls through that network that they've established to say, hey, this opportunity exists, would you consider applying? So that's my process as I understand it. But again, we could always contact this group, Mr. Warren, let me rephrase that, can always contact this group with Mr. Murphy and see if we can't get a better price, or try to refine the process and the scope of what they're doing to get a better price. But happy to see if Mr. Warren can reach out to FSBA and see what services they provide. And we can ask some other school districts who over the last few years have had to hire counsel and see if they used any external counsel as well and see what other options exist.
That was not excuse me if I did not clarify, it was not to direct us to FSBA. What I was saying is that for the amount of money that this firm is charging for a position that's not as high of a level position as the superintendent of schools, that the FSBA amount was less. That's what I was saying. So I'm not saying that we need to do FSBA. I think that there's value in having conversation with the firm. I just think that price is a bit high. So.
All right, thank you, Ms.
Thank you.
Fields. Ms. Wyatt, you're recognized.
Thank you. I'm becoming a little bit frustrated with the process. Last time we had a robust conversation about advertising and some of the things that we were looking to do. And I went back and watched it earlier this week to make sure that I had asked for the things that I thought I had asked for. But two of the things that came up was the salary range. Looking at the Indian River County attachment that was provided to us, they're advertising at $190 to $220. So I'm concerned that our salary for an attorney for a school board attorney in the current market is probably not going to attract even a number two from another county to come here. I think that's something that we need to look at based on what our surrounding areas are offering. I had asked that we had salary information from other counties and was told that would be provided today. And then additionally, we talked about an RFP. The conversation then was that we would be bringing an RFP for us to approve to send out an RFP to hire a consulting group. It doesn't look like we're approving an RFP today. Subsequently, Mr. Warren emailed saying that we were looking at this group. And I responded saying, I'm thrilled to see it expedited, but I really feel like we need to see at least 2 to 3 proposals because the number came in very high. And it's, I don't feel confident spending taxpayer dollars on something that we don't have at least one other proposal to say, yeah, this is kind of in the range of what that goes for. So I don't know where we go from here, but those are my current thoughts.
All right. Thank you, Ms. Wyatt. Ms. Miller, you're recognized.
Thanks. I just want to go back to best practice, not because I know Mr. Thomas or because I know a firm to be hired. I try to be very ethical in my work practice. But anyways, I was similar, the notes from the last meeting that we talked about in RFP, we talked about having multiple people to look at. I think this is high, what was provided. I don't, Chair, maybe you can remind us. I thought you had already looked into FSBA, if that was something they did. But I do know there are other organizations that do this, and I was hoping we would have something more than one. And I understood the email said you took the directive from the board, but from the board member, but the discussion, and I think Ms. Fields has already clarified, she was making a suggestion, and we needed to be able to make a decision by looking at multiple entities.
Thank you, Ms. Miller. So I would say that it was stated on record that the salary was negotiable. I know that for a fact because I know I stated it on record that the salary we had listed would be negotiable. I did not get a consensus from the board that we wanted to move forward with the RFP because of the timeline. We felt, or I heard, that trying to issue an RFP would extend the period of time. So even if you look at the proposal that's submitted to us at this point, it's a 12-week timeline. So in order for the board to even consider a vote on that proposal, I mean, look at where we're at as far as when our next public board meeting would be to actually vote on that. So, and then that puts us 12 weeks out on that proposal in particular. So I'm listening for guidance. I mean, my recommendation, I can bring a recommendation to you as a board member and as your chair. But I mean, obviously, this is the will of the board. If I was to look at it in relation to the timeline proposed by this consultant, you're looking at 12 weeks. So if we were to move forward on bringing him in during our next work session, which would be 9 a.m. on October 8th, we could hear from him at that point. And then on top of that, I do have Mr. Murphy that's going to bring forward a necessity for a special called forward meeting for another issue on that day. And that would be our first opportunity to actually even vote on this proposal that's in front of you from this consultant. To me, that saves 3 weeks in the timeline. If he's proposing 12 weeks, and we were to actually consider it as a vote on October 8th during that special board meeting that's going to be called for soon, that saves 3 weeks in the timeline. But I don't know, and Superintendent Hyde, you can maybe speak to this a little bit more. If we were to issue an RFP on this, what's the process for that? Because we've never done this before. How long does it take, Mr. Warren? And maybe you can answer that question. Because here we're now week 7 on this posting.
That has been my concern with the RFP, which I'm happy to be at the will of the board to do what you wish, but a request for proposal in my world means that we're going to generate, here's the kind of things we want from a firm or from an entity. We're going to send that out across to multiple people. We're going to have a timeline, whatever that would be with respect to in 10 days, please send us your proposal. Then we would gather those. We would have to either score them or present all of them to you, and then have the board arrive at a conclusion of this is the firm we would like from that RFP. But there's a process of notifying those entities, information coming back, and then pushing it to you as well. That's different than the option B of can you bring us 3 or 4 firms with contracts or proposals to review. In my world, that's not an RFP. That's bring me several different vendors and look at the services and the costs, which I'm happy to do as well. Again, I'm not playing the terms, but the RFP process is a very specific process, which is different than let me bring you back 3 or 4 different draft contracts with services that they could render for a fee for you to review as a board.
Thank you, Mr. Warren. Ms. Wyatt, you're recognized.
Thank you. So we did this before because that's how we determined our superintendent search group. We were brought 3 different contracts, 3 different proposals, and that's how we ended up going with FSBA. So I don't think we're reinventing the wheel here. I don't know the best. I don't know. I was trying to look back at my emails to see when we did that before and how we did it. But I think that while, yes, we want to get someone in here quickly, the most important thing is that we get it right. And so if 3 extra weeks means getting it right, then I am okay with 3 extra weeks. I'm sorry, Mr. Murphy. I know that.
I'm saying nothing.
Stand by. Is that all you have, Ms. Wyatt, at this point? Okay. Mr. Murphy, thank you.
Thank you, Mr. Chair. I think that what Mr. Warren described and what Board Member Wyatt described is what I would envision. There's not a formal RFP that would be required. Simply gather additional contracts to the extent you can and present them to the board based on whatever you're able to do. This proposal that was from the Government Resource Group was one proposal that we, as I don't rehash what Mr. Warren said, that was the understood direction from the board. I can't say whether that price is in line or not. I have nothing to evaluate it on. I will say that I know Mr. Thomas, and I know that group, and they do good work. And you saw the materials that were provided. They have access to lawyers that would be helpful, I think, here. And so I think perhaps proceeding with getting maybe other, if there are any, if that's what the board wishes to do. I don't think you have to, but if that's what the board wants to do, that's certainly something that it could do. But I don't think it has to go through a formal process. I think what you have in front of you is sufficient legally, but it's not my decision, it's the board's decision as to how it wishes to proceed.
All right. Thank you, Mr. Murphy. Ms. Miller, you're recognized.
I just want to say, Mr. Warren, I apologize if we didn't send the clear enough message, because I really thought today was going to be multiple groups to look at. And I think that maybe was a misunderstanding in the direction you were given. The RFP process is long, but bringing multiple groups, one, it looks like we're being ethical in our transactions because we're not favoring one, which was no one's intent. The suggestion to bring someone that we all know and does good work is great, but the constituents want to see their value of their tax dollars. So if I would be Chair Allen, I would be for what Mr. Murphy just explained and not going through this long process, but just having some comparison. If that's what we're doing with builders, that's what we should be doing with our attorneys.
All right. Thank you, Ms. Miller. So, I guess, if anybody else has words to speak to this, but at this point, we're looking at, if you want to add to this, Mr. Warren.
I'm very comfortable with option B. I just needed the specificity because I wanted to honor the RFP discussion as well. We can go back and within the timeline that Dr. Allen prescribed, I think it was the October 8th, we will reach out and we will ask to receive multiple offers from at least 2 or 3 other folks that we know are in the state of Florida or within our closest geographic areas we can find. And then we will put that alongside the contract offer that we have for SGR and evaluate the services that each provide and the cost and timeline with which they can provide it. And then the board can make an informed decision from there if that serves the board and what I understand to be the directive.
All right. Thank you, Mr. Warren. And Ms. Wyatt, you're recognized.
Thank you. I appreciate that, Mr. Warren. Looking at the salary, I still am very concerned that, yes, I understand that you made a comment in a work session that applicants looking are probably not going to watch. Can we get information from our surrounding counties as to what their salary ranges are to see how close we are? It sounds like we are not very close, even at our top range, before that October 8th meeting.
We'll work to reach out to districts as well to get that for you. And I want to be specific again. We're going to reach out to try to get general counsel for school board, not like municipalities or otherwise, because those entities do function in different lanes for funding or otherwise.
Absolutely. I think that my concern is that we're not in line with other school board attorney salary ranges. Thank you.
All right, thank you, Ms. White. All right, if I see no other discussion on that item, I'm now going to recognize Mr. Murphy to bring forward some thoughts for us here on this next item.
Thank you, Mr. Board Chair, and I appreciate the opportunity. I'm going to ask for advice pursuant to Section 286.0118 of the Florida statutes. There is a pending litigated matter that's currently pending in the United States District Court for the Middle District of Florida, Tampa Division, in which the school board is a party, involving an interpleader of funds, involving, the title of the case is Law Office of Stanley Bunner Jr., PLLC versus the School Board of Polk County, Florida, and Scott Favor, public adjuster. It has to do with interpleading of funds based on hurricane damage on buildings that were school board related. I would ask that, since that case is pending, I would ask for, or announce publicly that I need advice concerning the litigation. The subject matter of this closed session meeting that I'm asking for the board to hold shall be confined to settlement negotiations or strategy sessions related to litigation expenditures. As you may or may not recall, the entire session, the closed session, would be recorded by a certified court reporter. The transcript would be sealed until the conclusion of the litigation, that is the subject of the meeting, at which time it would be then filed and open for public. So everything that is said at that meeting would be transcribed word for word. So those would be the minutes. The entity, we have to give reasonable notice of when that closed session meeting would be. We could certainly do that, and we're prepared to do that. I was thinking we could do it at 9 o'clock on October 8th of 2024, when you are already going to be convened for a work session. The statute requires that you open this closed session in an open meeting. You then go to the closed session. Only very specified people can be in attendance. They are the elected board members, the superintendent, myself, and then our outside counsel, which in this case is John Stidham and Hank Campbell, and the court reporter. That's it. Those are the only individuals who are permitted to attend that meeting. I would suggest it will last about an hour, no more, hopefully. And then we would conclude that meeting by coming back into the open meeting and announcing in front of the court reporter that we are closed. And then you move forward. So if the board would allow that, I am asking for and seeking advice relating to settlement negotiations and litigation strategy for this pending litigation that we are a party to, we being the school board.
All right.
So if I have the board's consensus to move forward with that, we will make the necessary arrangements for that meeting to be held on October 8th, 2024 at 9 o'clock a.m. after you've already opened your already scheduled work session.
Very good.
Now, having said that, we cannot vote at work session meetings. So in order to officially vote, hopefully, to approve things in that litigation, we will need to have a special called meeting, which I would recommend be held on October 8th, 2024, following your work session, so that you could then, in open session, in a special meeting, vote for hopefully a proposed settlement. And so that's what I'm recommending.
All right, so there's the recommendation. If there's a consensus on that, we'll move forward on that. And Superintendent, I would ask, when we log that and communicate that we can add the decision to vote on our vendor for the general counsel search, if that's the will of the board that day as well.
Sir.
All right.
Sure. That meeting is a special meeting of the school board. We'll make sure it's noticed properly.
All right. Thank you, Mr. Murphy. And Ms. White, you're recognized.
Thank you. As far as the board meeting, are you thinking it would be advertised to begin at the end of the work session, or you're wanting us to come back at 5 for those two?
Good question.
We've usually done it just, oftentimes they'll like if we think we're going to be done at noon, they'll advertise it at like 11:30 so that we can roll right into it if we finish early.
I will defer to the board chair on that, but what's your thinking on that?
Yeah, definitely back to back.
Yeah, we want it back to back.
Later in the day. So depending on the necessity for length of time from you, and we don't want to chew too much more.
As long as there's not an objection to us having it immediately following the workshop, I think we can take care of that. And we will manage the workshop topics accordingly.
I would like to have a time associated, though, however, with the special meeting, rather than simply saying following the, because there may be people that want to come, and they'll need to know a time. So do we want to say 1 o'clock? 12?
May I work with Ms. Winchester just to get a sense of what topics need to come before the board?
Sure.
The next workshop? And then, yes, from there, I can get a better understanding of what our time constraints may be.
I just think it would be preferable to have a specific time period for when that special meeting would be convened. And yeah, I think the suggestion is let's keep rolling.
Yeah, indeed. All right, board members. At this point, I'm going to move down to board member comments. So if you have any comments that you would like to bring forward at this point, now would be your time. And if there's nothing else to come before the board, is that you?
Sorry, I'm the current speaker, so it wouldn't let me press my button.
Mr. Chair, I know we're wrapping up. I just want to make sure I put on the record, if I may, families and staff will continue to receive updates as to our tracking and monitoring of the storm. At this time, the trajectory puts us outside of the cone by and large, but we will have some impact with tropical storm winds and gusts. So we continue to monitor. This afternoon will be the best update for me to make a decision. I do not anticipate any impact to Wednesday's operations because the storm and winds aren't even scheduled to arrive until and impact our area till 8 to 10 p.m. But Thursday and Friday are questionable at this time, so I will provide an update to staff. I just want to get that out there on the record.
All right, thank you, Superintendent.
Thank you, sir.
Okay, Ms. White, you're recognized.
Thank you. I just wanted to give a quick update. In speaking with Mr. Murphy, the team has been, we talked last time about the school lunch policy. They are working with Neola to come up with a policy. There's not one currently, but that's, as Neola said, just because there's not one doesn't mean there shouldn't be one. So they're working on some language for that. So, but they are indicating that the parents' rights section of the policy is where that would best fit. And then the other question I had is, can we get electronic copies of the resumes that have come in so far?
Yep, we can do that.
Thank you.
Thank you, Ms. Wyatt. I did want to also note that you've now received 2 notifications on the evaluation process, and I want to draw attention to Superintendent's contract language that does say that we should be completing his evaluation by September 30th. We did move away from jot form and brought it in-house, and I appreciate Ms. Pasco is extending her staff for us to build out the Microsoft forms around that as well. So if you can please complete his evaluation before September 30th, that would be much appreciated. All right, if we have no other business before the board, this meeting is adjourned.